Thursday, we were not very sure. And of course, what left to us was to enjoy the darkness. Right now, TV no longer closes. For those of you who remember closing, at midnight in this country, TV used to close. But exactly midnight, TV would close. And for some days, power would be off. And of course, somehow it affected our family planning efforts. Because the only activity that was left in there was to proceed and do what we do. Ladies and gentlemen, we have moved so far in technology. And of course, when we talk about technology, we are speaking about virtual meetings. We are speaking about cashless transactions. People are able to use their cards to make payments. So certainly technology has impacted on our lives vividly. Most importantly, the two aspects that come up very clearly for me is information sharing and customer experience. Ladies and gentlemen, allow me to quote that Jerry Gregory said that customer experience is the next competitive battleground. And allow me to mention again that customer experience is the next competitive battleground. Today we are here because of an enhancement in terms of our customers that are out there. We have smart access application that is going to be used to make sure that individuals out there continue to enjoy the services as they go to hospitals. We are talking about virtual access of services. And when we talk about virtual access, we're talking about hospital initiations. So if you're going to go to the hospital, you're going to avoid things like lining up. You can initiate your visit. There are topics, health topics that will be shared through this application. There are a number of facilities that you're going to be able to appreciate about the smart access. Ladies and gentlemen, my name is Gava. Allow me to welcome you. I'll be your host this morning, and good morning. Ladies and gentlemen, once again, good morning. Good morning. You are welcome to the Smart Access Launch. In my rehearsal, you people clapped so hard, but now I don't see why people are not clapping. You are welcome to the Smart Access Launch. That's better. Ladies and gentlemen, because this is a formal event, allow me to request you to rise up, and we start with the anthems, and then dash into the opening prayer. I request the Kandanke team, whenever you're ready, please lead us through the anthems, the Uganda anthem and the East African anthem. Thank you.
Tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Thank you very much, ladies and gentlemen. As we stay standing, can I now invite Josephine Nanenjo, who is our customer support and sales executive, to come and give us the opening prayer.
Good morning, ladies and gentlemen. You're most welcome. Let's humble ourselves and pray. Father Almighty, we thank you for your good. We thank you for each and every good thing comes from you. We thank you for this beautiful day. We thank you for each and every one that is here. We thank you for the entities they represent, and we thank you for we know that you foreplanned that they would be in those different entities. Father, we thank you for this far you've brought us. As we start off this day, we ask for your wisdom, we ask for your blessing. We ask that you will guide us. As we come to commune as brothers and sisters you've put together, we pray that you will help us, my Lord. May each and everything that you're going to purpose on, discuss, see, share, may it at the end of that day benefit us, and may everything be to the glory of your name. Thank you, Jesus. In your precious name we've prayed. Amen.
Using the words of Josephine, brothers and sisters, take your seats. But can we give Josephine a round of applause for the beautiful prayer? Ladies and gentlemen, once again, you're welcome. Allow me inform you that we have different individuals within us that are representing different institutions. And in terms of protocol, I'll be going through a number of them as time may allow. But also allow me welcome, when you're talking about smart access, you're talking about technology, you're talking about virtual. So allow me welcome our online team that is on Zoom and YouTube. Thank you very much, the Kadanke team, for ensuring that the online team is alive and well. So we send our regards. We'll be able to send out some emojis for you to show that we are happy down here. Friends, technology has improved things, because recently when my landlord sent me a message to pay rent, I only replied with a thumbs up of I am ready. But when I do not have rent, I send an emoji that shows that I'm very sad. And so that shows I do not have to constantly interact. And so technology certainly has done as well. With us this morning, ladies and gentlemen, are different players that have joined us at this launch. And allow me to start with our keynote speaker, Mr. John Nchisache, who is the CEO of Uganda Insurance Association. Sir, please rise up for recognition. Can we give him a round of applause? Mr. John Nchisache from the Uganda Insurance Association. We have Mr. Solomon Rwando, who is an experienced insurer with over 36 years. He's going to be our moderator. Mr. Solomon, please stand up for recognition. Can I request we give him a round of applause? Thank you very much. We have Harrison, who is the group. Can we give him a big round of applause? I'll be going through the protocols as time may allow, but you may appreciate that we've lost about 30 minutes. We have different players that have joined us this morning. I do not know if Mary Stops Uganda, are they here? Please rise up for recognition. Those are our partners. We can give them a round of applause, even in absentia. We have CCare, IHK, are they around? Please stand up for recognition. Thank you very much. You need to be seen so that when people are looking for the solutions, they know where to come to. We have Millennium Dental Studio. Yes. Thank you very much for adding the word studio. Otherwise, people would come for pictures. We have Millennium Optics. Can we also give them a round of applause? I'm reliably informed we also have AAR, please stand up for recognition. Thank you very much. I'll be going through the protocol within time, so allow, ladies and gentlemen, to roll the program. Allow me get to the next part of the agenda, which is now welcoming remarks. Friends, the gentleman I'm going to invite, he is passionate about technology. He enjoys traveling, and he specifically told me he enjoys music, but bongo flavor. If you come from Kenya or East Africa, you understand what bongo flavor means. But he also told me he likes watching movies in the cinema. He likes positive conversations, and he believes that the greatest joy of humanity is interacting with individuals, exchanging experiences that enable you to learn and grow. Most importantly, he is the Group Managing Director of Smart Applications International Limited, an ICT service provider in East, Central, West, and Southern Africa. Ladies and gentlemen, let's welcome Harrison Moiru, the black man from Kenya.
I didn't know when we were having a tete-a-tete with Gava that he would come to this podium and release all my secrets. Good morning, everybody. Ladies and gentlemen, members from different insurance companies, members from different healthcare facilities, staff, members of the media, representation from government, representation from corporates, all protocols observed. I take this opportunity to welcome you all as we launch Smart Access in Uganda. My name's Harrison Moiru. I'm the Group Managing Director of Smart Applications, and I'm always amazed by the warmth and hospitality of Uganda. And therefore, we are indeed proud to be part of the Ugandan ecosystem in healthcare and transforming how healthcare is managed and serviced in this market. We, as Smart Applications, are honored by your presence this morning. We do not take it for granted that amidst the many things that you have on your desk, the rapidly changing environment, the delicate balancing act that we are doing in our organizations. I know a number of us had to pass through our offices and institutions this morning. You have made time to be with us. And it's because we have a key agenda that glues us together, and that is the agenda of healthcare. Healthcare is indeed a fundamental agenda in our quest for development and welfare of our people, and is entrenched within our Millennium Development Goal number 3 on healthcare and well-being. However, we always find ourselves lagging behind in capacity, technology, and resources in meeting the healthcare needs sufficiently across the African continent. Case in point, according to the FSD report 2022 for Uganda, medical insurance penetration was at a low 1%, which means that 99% of the Ugandan population is in dire need of relevant Uganda healthcare access solutions. We, as Smart Applications, have taken this challenge up. And what we launched today is a testament of our philosophy of creating easy, fast, and secure access to healthcare services across Africa through homegrown, relevant technology to enable our stakeholders represented in this room and beyond, the medical insurers, the medical brokers, the corporates, the HR fraternity, the HMOs, the hospitals, clinics, and doctors to address and fill these needs for the Ugandan population. We have not walked this journey alone. I remember when we came to this market, it's about 11 years ago, we had to examine and work with each and every entity within the healthcare ecosystem to understand the needs of this market. Through local collaboration and data-driven insight, we have been able to move together as an industry, having jointly, together with yourselves, introduced biometric smart card technology in this market for access to healthcare services. And today we celebrate yet another milestone in this market through the launch of mobile phone-based access technology through our Smart Access app that we'll be launching today. Indeed, it is an exciting time to be in Africa. If you're sitting right next to a person who is gloomy, please feel free to turn across to them and tell them it is an exciting time to be in Africa. Why do I say this? It is because our challenges have turned to be our greatest advantages and our greatest opportunities. And I'll give you an example. Do you know why mobile's penetration has been the highest in the African continent? Higher than the Europes and Americas? Please also feel free to ask your neighbor that question. Ask him or her, do you know why? Mobile phone penetration has been the highest in Africa, higher than the Americas and the Europe continent. It is because our challenge of living in tents could not allow us to install landlines in those tents. And that's why I'm saying that the opportunities lie in the challenges and providing solutions to the challenges that we find that are unique to the African continent. Indeed, it is estimated that 84% of the African population will have access to a mobile phone by 2025. I believe Uganda has already passed that mark. We as Smart have embraced this channel of customer engagement through Smart Access, which we shall be deploying today. Another interesting fact is that it is projected that the African healthcare business will reach 62 billion US dollars by 2024, according to the report by the IFC and the World Bank. And that by 2030, 14% of business opportunities in global health will be within the African continent. My fellow stakeholders in the healthcare industry, this is our time to positively impact healthcare through easier engagement with our customers and answer to the question of healthcare access in Africa. Therefore, as we stand here to launch the Smart Access solution, which will empower and interconnect our patients, our members, medical insurers, medical brokers, the HR fraternity, corporates, medical insurers, healthcare facilities, and even government. We make a commitment to this industry for easy, fast, and secure access so that we have a rallying call for collaboration through smart digital engagements to spur recovery, growth, and profitability for the healthcare sector. Definitely, this is the beginning of a journey, and some of the wider questions that we must answer as we go ahead in what we shall launch today and in addressing the wider healthcare agenda within the Ugandan nation are questions of accessibility and affordability, questions of cost management amongst the different stakeholders, questions of agility, questions of tapping into the online digitization and automation capabilities, and reinvention of our healthcare service delivery models so that we are able to improve that number from 1% to closer to the 90% of healthcare coverage in Uganda. We remain committed to being front runners and key collaborators with each and every one of you in this quest. And together with this continued partnership, we all look forward to achieving even higher frontiers in terms of the healthcare agenda in Uganda. Ladies and gentlemen, I once again take this opportunity to welcome you all to this event, and we thank you for your participation and collaboration as we launch Smart Access. Thank you, and back to you, MC.
Ladies and gentlemen, Harrison is the Group Managing Director. I think he deserves a bigger round of applause. Using his words, it is an exciting time. Once again, look at your neighbor and tell them it is an exciting time to live today. Sometimes the potholes may have shaken that answer out of your head, but be reminded that it is better to live today. Because as Harrison was speaking, I sat down there, then I imagined the days when we used to buy airtime, but we also had what we call service charge. So for you to receive calls, you had to pay a certain amount. But also remember the days when you had to go to a hospital and wait for a specific doctor. And then all the time you have to peep in his room to see if he has come. Today we are launching a solution that is going to make all that history. You initiate a hospital visit and ensure that the doctor is there and everything is as planned. So ladies and gentlemen, it is an exciting time to live. When Harrison talked about it, I remembered the days of the letters and posta. I don't know if you remember very well that there was a stamp. When you used to have to transport a letter from one place, you needed a stamp. But when I look back, I remembered that the cost of the stamp itself was equivalent to the cost of transport to take the actual letter. But today, all of us can reliably communicate through the different channels. So certainly it is an interesting time to live today. Friends, continuing with the program, our next presentation on accelerating healthcare, business recovery, growth, and profitability is going to be presented to us by a lady who our experience pans out about 8 years in ICT and over 11 years in healthcare industry, spanning from HMOs, medical service delivery, currently functioning as the vice chairperson of the board of directors of Uganda Healthcare Federation and heading the e-health club, championing the interests of technology partners in the health space. Friends, join me as we welcome Judy Mogoya, the country manager of Smart Applications International.
Good morning, ladies and gentlemen. Good morning. I trust you had a beautiful breakfast. I'm so excited to see you here today, and I want to thank you very, very much for honoring our invitation this morning. As our group MD has said, you could have been anywhere else, but you chose to be with us today. So for that, we are saying thank you very much. So indeed, I want to honor each one of you in your various capacities, heads of institutions, government representatives, our group MD, our group marketing director. They all came from Nairobi to be able to join us in this event. And of course, our online community, we are saying thank you for joining us online. I hope you do have an exciting time, because indeed today is a game changer. I want to also welcome members of the press this morning and members of our staff, Smart Applications. We are currently in 11 countries, and today they have joined us online. So to the entire community, I say karibu sana and welcome to this particular launch. So indeed, we are having an exciting opportunity. I'm hoping that the slides are going to follow me. And our theme this morning is about accelerating healthcare business, recovery, growth, and profitability. I want to give you a little bit of a background about who we are in terms of Smart Applications. You've heard about us. Most of you know us. But it wouldn't hurt for us to just go through it a little bit. So our corporate vision is to create a smarter society through world-class, innovative technology solutions. And this is supported by our mission, which is inspiring a world of convenience. By the end of today, we want to demonstrate that indeed we are inspiring a world of convenience. Our footprint, as you will see behind me, suggests that those 11 countries that I talked about are well represented. And we have members up to about 1.5 million who are utilizing the smart platform in those 11 countries. And in those 11 countries, we have over 7,200 service providers, medical service providers, who are also represented here today. We are happy to have you on this platform this morning, that are representing and actually championing the utilization of SMART across those 11 countries. Indeed, these are exciting times. In our next slide, we want to just show you and demonstrate that as an ICT solutions company, we actually do develop and transform from within, because we develop these solutions ourselves. We do not get solutions and add on top of that knowledge. We develop the solutions ourselves. And we've done so for the last 17 years. And these solutions cover a wide range of a profile, from biometric member identification, as our group MD has mentioned, to member management in terms of onboarding and eligibility, to provider management, including the Smart Health Hospital Management and Information System. This is a hospital ERP system that was designed and developed in-house. So surely with the 17 years plus in terms of our experience, we did recognize that there's some gaps and indeed needs in terms of the utilization of hospital management systems. And in Uganda, that statistic sits at about only 20% of the overall medical service providers actually have a hospital management system. So there are opportunities in terms of automating processes, and we're not leaving any sector behind. In Uganda, we are currently installed in about 728 service providers. And when I say service providers, I mean hospitals, clinics, laboratories, pharmacies, outpatient facilities, So there are about 728 in about 92 districts in Uganda. So indeed, we have championed the utilization of technology in healthcare and be able to transform that journey. And that journey is not only about pushing a solution to market, but it is about ensuring and enabling the users to use the technology to automate and provide efficiencies to their operations. So that is the mandate for SMART. So we do not come and install and take off. Even support is guaranteed and assured in terms of us ensuring that we provide that listening ear to the medical service provider when they need it. Changes coming through. And indeed, we have a very youthful population. At least more than 70% of our population, especially in Uganda, is very, very young. I think we all know that, very young. And that provides an opportunity and a platform for change. Because with the youth come innovation. They want convenience. They don't want to be held back. But it also looks at improving governance with a focus on diversification and the infrastructural boost in Africa as we get connected. Even with the challenges, with the opportunities that are there are also challenges that you and I are aware of. A price-sensitive market with little market data. Finding skilled labor is still a challenge. Electricity and infrastructural changes, those ones are still a challenge. Supply chain challenges, tough government policies, and a difficult regulatory landscape, and the high cost of securing capital. These are some of the global challenges that we see across board. But today we want to focus a little bit more about the challenges in healthcare. So bringing it home in terms of our own industry, we're looking at low insurance penetration in Uganda, which is still below 1%. And I'm very happy this morning that Jonan is here with us and is going to talk a little bit more about this and how can we enable it to improve. On top of the low penetration rate, we also have limited awareness in terms of what is insurance and how does it benefit you? How does it benefit your organization? How does it benefit that member, my spouse, my children? And indeed, when people think of insurance, they think of cost and they're like, no, I don't want insurance. Why should I go for it? My house has been safe for the last how many years? Why should I even think of insurance? But that is the knowledge, that's the gap that we have. And even the contribution to medical insurance, if we look at what is the percentage of personal or individual covers, where you and I go and purchase a cover for yourself, you'll find that those percentages are really low. It means that we still have a gap, either in knowledge or in adoption of technology, of insurance across board. So in terms of digitization, this is another opportunity in terms of opening up the markets, ensuring that there's convenience, ensuring that there's accessibility, ensuring that there's access to information when and where you need it. So indeed, the insurance sector still has a role to play in terms of bridging that gap between the insurance sector and the end user, which is you and I, that is the member. And then we look at the age-old problem of fraud. This is still an ailment in the industry and affecting the next item, which is the high loss ratios. So these are some of the challenges within the health sector. And today we want to see how then can we accelerate healthcare, business recovery, growth, and profitability. In the next slide, we're looking at the key focus areas. I will ask our person to, if you can go to the next slide. The next one. Okay, thank you. Now I'm sure we are together. So we are looking at aspects of agility. And when we talk about an agile market, it's about us being able to adapt to the changing landscape. And we're looking at dynamic financing models, invention and adoption, which I've talked about, bold partnerships. We should not be sitting at the end of the table and not realizing or recognizing the different players in this particular industry. You have the insurer, you have the medical service provider, but you also have the technology partner. And at the end of that chain, you have the member. And therefore, these partnerships, once they are formed, will be speaking a common language in terms of our intervention and, of course, advocating for policy change. One of the biggest things that we talked about earlier was on claims ratio, and that ties in very well with cost management. So we're saying that indeed using advanced analytics and AI, I'll be demonstrating what that means in a little while, and this morning you will be seeing our launch and how we've been able to digitize the process and indeed provide the consumer with better information so that you can influence behavior change. At the end of the day, we're talking about affordability. If technology is not affordable, then adoption becomes a challenge. We're also looking at reinventing healthcare products and delivery, and this is through platforms that we saw coming through during the COVID era, such as telemedicine or telehealth, as it were, remote lab tests. Before COVID, you never knew that you could be in the comfort of your home and the drugs find you at home. You never knew that you could consult a doctor on phone and they give you the right diagnosis and deliver to you, or even come and be able to do a test at your home and be able to deliver for you your drugs. So this is about convenience. And convenience is linked together with innovation. And once we have innovation, technology sits at the heart of product development. Every time the players in this room, scheme administrators, we're always looking at new products to be able to attract or address the needs of a niche market group or a niche age group. And that is the only enabler is technology in that entire cycle. As we go along, we also see that we need to tap into what we call the online community. And this community is growing. Our group MD talked about the mobile penetration rates in this country. You know, it's greater than 80%. And it means that using the convenience of having a gadget that can be able to speak back to you looks at areas in which we can tap into at individual level. When we look at wellness, you as an individual, what steps are you taking towards ensuring that you're keeping yourself healthy? Instead of running to the hospital, what are you doing? Where is that information? Where can it be found? And in terms of awareness, if I needed to get medical help, where would I go? And in terms of cost and accessibility, these are all aspects that are key focus areas for us this morning. As I go to the next level, I want to demonstrate to you the impact of data that we have. And this data just looks at a time scale of 2020 into 2021. So what we were comparing here is the smart traffic and the claims value. So we're looking at the percentage change in traffic and the percentage change in amounts. Let's start this discussion from home, and that is in Uganda. So you look at that period, 2020 into 2021, the traffic percentage change was 115%. These are the number of people who are visiting the hospital, the clinics. I've been seeing in your own particular areas. But you can see that when you're able to have data that compares not only, because looking inward is very local, that is localization, but when you look outward and say, how are we performing against other countries, for example, Kenya, the change was only at 8% in traffic, and in amounts, 22%. In Rwanda, we're at 28 and 38%. So you can see that there is a shift. In Tanzania, the change there was a little bit drastic because we had not been in the market and then we came in. So there was a significant jump and change in terms of us pushing to market the smart product. And therefore, you will see the changes at 188 on traffic and at about 300. But if we look at the overall performance, in terms of the traffic and value, the difference in the change, we're looking at an average of 52% of a change in the traffic and 79% overall in the amounts. I'll just show you a little bit about another change that we are looking at here in terms of claims value. Again, this is for 2021 into 2022. So you have time periods where you can compare. Are we getting better? Is it getting worse? I'd like to draw your attention to the Uganda profile. We are now in that period, 2021 into 2022. It was 17% for the traffic, and the change in value was at 40%. So data definitely gives you brilliant insights into what is happening in our industry here in Uganda. In terms of patient traffic trends, I'd like to draw your attention to this particular graph. This is what data gives you in terms of insights to the very specific location where this traffic is coming from. And as you can see, that particular map, that traffic, I think you need to go to the next slide. There we are. The traffic in this region, in the central region, has been the highest. And that is very consistent with the kind of data that we have in terms of the number of service providers or utilization and the effects of urbanization, where people, the economic activities are mostly centered within the central region. You will see that the traffic is highest within the central region. So if you look at the month of December, and we look at the comparative data from 2020, 2021 into 2022, you can see that it's been significantly going up as the years go by. Started off by 49,000 in terms of patient traffic, into 2021 at 60,000, and in 2022 at 75,000. Indeed, that paints lots of pictures, and I'll leave you with that thought as we try to delve into what else could be influencing this kind of patient traffic trends in this period. Let's look a little bit at average cost of healthcare recovery. So what we did was to compare 3 periods, and that's between the period 2020, 2021, and 2022. If you look at the outpatient costs, in 2020, on average, they were at about 80,000. And this is data we've been able to collect because of the insurers that are using our platform, and of course, the service providers I talked about earlier. And we're able to ascertain what are those average costs. So this is reliable data. It's not sample data. It's reliable data. So you can see that in 2020, outpatient costs grew from about 80,000 to about 98,000 in 2021, representing about 22.9% change. And in 2022, it went down. So this can be attributed to quite a number of things, but let's look at the inpatient costs. We see a similar trend of about 25% increase from 2020 into 2021 at 1.2 million shillings on average. And in 2022, we have a 0.4% change. So when it drops, are we saying that we are a lot healthier? Are the interventions better? Perhaps, we don't know. But that is where data comes in. Because then, with the capture of data, using the specifics that we're currently using, for example, the capturing of ICD-10 to be able to define the diagnosis, to capturing the services, actually now tells you about those specific trends that I talked about earlier. You can see the cost of medication has significantly gone up. It went up by 27% into 2021 and 22%, at negative 11.7% in 2022. So traffic has been increasing significantly. The lab costs may be attributed to COVID testing because obviously this was a little bit, there was a drive towards testing and knowing your status, keeping away, keeping healthy and so on. So that attributed to that increase from 2020 into 2021. On the specialist traffic, here we're looking at not general practitioner consultation, but we're looking at the physician, gynecologists, cardiologists. So this is the kind of traffic that we saw. And you can see there is indeed an increase from 2021 into 2022, from 46,000 into 66,000. Indeed, these are very interesting insights in the healthcare space that provides us with the information whereby we'll be able to ascertain what exactly are those diagnoses that are coming through. If you could go to the next slide. So on the top diagnosis in 2021, you can see what those three, let me just focus on the three. 2021, we had acute respiratory infection, we had malaria and hypertension. In 2022, the acute respiratory infection still was topping the list. And of course, you know, this is post-COVID issues. And we still have an issue with malaria, as you can see. And then there is a new entrant there in 2022 on bacterial infections. When you look at the same data, but look at the top average costs, you'll see that now things begin to shift. There's a bit of a change there. So there's a disc bulge, but when you look at 2022, you compare it to leukemia. So you begin to see that indeed the adult respiratory distress syndrome takes the space of about number 4 there. And that can help you look at some of the interventions that we are having and what kind of costing models should we have. Does it actually help us to come up with package prices for some of these very common ailments so that we have a win-win situation, both from an insurer point of view, but also from a provider point of view? You cannot provide services below your costs. So indeed, this actually points to information that can be utilized within the industry. If we go to the next slide. Thank you. Next slide. This brings us to an aspect that each one of us knows that it is a looming challenge, but we need to do something about it. And this is about mental health. Indeed, you can see the statistics there in terms of capture. In 2021, we have the anxiety disorder and depressive disorders taking the first and second level there. But when you look at 2022, we have the bipolar disorder, but the anxiety disorder is still there. The depressive disorder is still there. So as corporates in this particular launch and today, we need to be able to address some of these key pertinent issues that are affecting us even right within our own organizations. Mental health is an aspect that we should not take lightly. It not only affects the health of the individual, the organization, but the nation at large. The news has been awash with different stories in the last 2 to 3 weeks, and it points to one thing: the mental issues. And I want to particularly thank Minette, because they've come up with what is called the Employee Assistance Program. Those are the kind of interventions that we require to be able to address some of these issues, especially when it comes to how do we deal with anxiety, depression, bipolar. And you can only get this information if you have correct data that actually shows you what is happening in the industry. As I come to an end, we're looking at economic recovery drivers. And the shift is that we should be able to invest locally. If we can go to the next slide. Identify and support industries that will drive economic recovery. Promote domestic spending through cash transfer programs. Protect our local businesses from foreign competitors, because these solutions are available locally. Safeguard industries that are vital to national security and promote exports. The focus on healthcare industry in Africa, it was found out through an economic study through McKinsey that about 12 trillion is contributed to the GDP, which is a boost of about 8% or about 0.4% in terms of growth. That's the economic impact of better health. So it not only affects it at the individual level, but it affects it at a global level. So therefore, proper healthcare helps us to lower mortality rates, and I believe this is an age-old thing across the board. It will help us to reduce absenteeism from work, improve productivity, and have happier citizens. In conclusion, as we go to the last slide, we're saying that the healthcare industry is on a recovery path. From the pandemic, where we were very strained, to where now health systems are able to pick up. It was able to open our eyes to new opportunities. So therefore, we are saying that Africa is well positioned to be the healthcare hub of the future. So we must indeed leverage on indigenous technologies to accelerate access and management of healthcare. Data-driven decisions are the way to go, and this is essential for faster and more efficient healthcare service delivery at all levels. We said the use of the mobile phone has a great penetration. Most of us will go back home to pick up that phone if you have forgotten it. But if you've forgotten your card, that is something that somebody will say, well, I'll pick it up in the evening. But therefore, it provides a platform because of its usability and accessibility. And it's right there in the palm of everybody's hand. It provides a ready platform for accessible e-health solutions, as we will be demonstrating this morning. So therefore, in conclusion, we are saying technology solutions must be patient-focused, they must be reliable, they must be convenient, and above all, they have to be smart to be able to address the needs of the sector. Ladies and gentlemen, it's been absolutely amazing having you here this morning, and I thank you very much for your attention.
They say that train a woman, train a nation. Can we give Judy another round of applause? I request the tech team, the Kadanke team, to give me the last slide that had the countries, the last slide of Judy's presentation. If you can get it over there, it will be very good. Judy, thank you very much for the presentation. Ladies and gentlemen, I'm sure that all of us now can be able to understand and appreciate SMART and what they do. And so that is the journey. So friends, I wanted to take you back to that slide for you to notice the presence of SMART applications. I think it's important that you see all those countries. I will not labor to go through all the flags, because then some of you will see that I'm not very good with geography. But some of you can also take pictures. But please note that they have presence in all those countries. So thank you very much. Ladies and gentlemen, when you talk about Smart Applications International, what do we mean? We mean technology solutions that simplify life. We mean digitization. We mean automating processes. And I think it's important, and Judy has been able to take us through the journey of once you have data, you can be able to then aggregate it together and do analytics on this information. We shared with you at a later point, you'll see we have papers that have our scanners where you can scan and be able to pick the application. For each table, there is that information where you should be able to pick the application. I think it's important for us to continue the conversation online. For all of us here, if you're asking yourself how you should contribute, I'm sure each one of us here has a Twitter handle, has a Facebook handle. It would be nice to talk about this conversation online, that you are certainly attending a launch of a smart access application, and through a line or two, this is how we all contribute to the conversation of getting virtual. Ladies and gentlemen, allow me to welcome these following individuals in no particular order. Allow me to start with Dr. Miriam Motero of CCare. If she's around, can I request her to rise up for recognition? Thank you very much. We have Mr. Makaire Frederick, the ED of Save for Health Uganda. We have Mr. Andrew Mogalu, the GM of CCare. Thank you very much. We have Dr. Anderbat Gonzaga, the director at Bethany Hospital. We also have Dr. Damali Anderbat, the director of Bethany Hospital. Please note that I read them separately. So they are not here as husband and wife. They are here in their own rights as doctors. So that's why I had to separate them, because then suddenly some people will be saying, why haven't you read them as one? Friends, the different partners that I talked about in the beginning have supported the launch. And so many of us who picked our raffles, we are going to be getting gift hampers. And these hampers are purely medical hampers, which speak to body checks, which speak to dental, which speak to eye checks. So I'm sure that all of you have a number that you picked and you'll be participating. And any of you that moved with Jesus today, you'll go away with a hamper. Ladies and gentlemen, as we proceed in the program, I like to inform that Judy talked about insurance, and many of us out there, even the corporates, do not fully understand how insurance operates. But the solution we are launching today is one that is going to make insurance visible. Because on many occasions we've made this argument that insurance is not visible. But now we are talking about insurance in this visibility. You'll be able to understand your utilization in terms of from the time you visit the hospital, how many hospital visits you have made, and how many doctors you've probably seen. And that information is important for you. But then you can also be able to see your utilization as an individual together with all your dependents. And that's the kind of solution we are launching today. Further to this, of course, I talked about initiating hospital visits to make sure that by the time you get into hospital, you are ready to be served. But also many of us, some of the statistics that Judy shared was showing some of the trends in terms of the diseases that are shaping up in this country. And all this information will be at the access of this application where you can be able to see what trending topics so that you can be able to help yourself grow and live a better life. At this point in time, our next speaker, who is our keynote speaker. Please allow me to inform you that our keynote speaker was specifically chosen because he comes from the Association of Insurance Companies. And as you heard Judy ably mentioning, the system that we are launching today, or the platform, is one that brings together the hospitals and the insurers. And this healthcare application links together those two institutions, because the insurance companies don't have hospitals, but they need to provide a service. So it brings them together. And that's why we had to bring someone from the association to represent insurance companies. Allow me inform you or read through a bit of his CV. Jonan is currently the Chief Executive Officer at the Uganda Insurers Association, and prior to this, he was a Deputy Principal at the Insurance Training College, the Head of Training and Research at the Insurance Institute of Uganda. Jonan has 15 years of experience and expertise in strategy, training, business growth, development, and managing partnerships. Allow me to inform you that it's not on his CV, but Jonan is married. Ladies and gentlemen, let's welcome the CEO of Uganda Insurers Association. Because today we are not sure Jonan is married to a female, I had to make sure that I leave that clear.
Thank you. Thank you very much, Mr. Gava. As introduced, my name is Jonan. Good morning to you all. You're most welcome to this launch. Allow me to stand on the existing protocol. The biggest problem I have is that I lead a membership body, and if I go into the details of now breaking down who is here and identifying and recognizing everyone, I may miss out on some of my CEOs who are present, which may then impact on my paycheck. So I will just stand on the existing protocol. But also, as you may have noticed, I think the previous two speakers, and that was Harrison and Judy, came in with a bit of gadgets. I think Harrison used his phone. Judy came in with her laptop. It followed her to the podium. And I have come with a piece of paper. Despite the fact that I have a gadget with me, I am using a piece of paper. And I request that my presentation is put up. I think when I was doing a bit of research and wondering what I would be speaking about this morning, in view of the fact that SMART is going virtual, my worry was that despite the fact that SMART is going virtual, the insurance industry is still manual. And my coming here with a piece of paper shows you how manual we still are as an insurance industry. I will not be surprised that my senior, Mr. Solomon Rubondo, when he also comes to moderate the session, he may follow and also come with lots of paper. So SMART, I would want to congratulate you on behalf of the UIA, on behalf of our members, for this great innovation, great initiative. Yes, they deserve a round of applause. That despite the fact that you have tried to empower our members, despite the fact that there's been a bit of slow uptake in terms of your innovation, in terms of your technology, you have not given up, and you're saying you will move forward, and the insurance industry will find you along the way. I think that is great belief in the potential of this industry, but also great belief in terms of the solution that you are offering, not only this morning, but that you've offered over the last 11 years. Now, I'm going to speak to you this morning, and if we can move to the next slide, I'll just briefly, and I was given only 15 minutes. I'll talk to you about the UIA, who we are, give you a bit of information on the insurance industry, talk about the insurance or medical insurance landscape, the challenges that we are facing, the opportunities, most of which can be solved by what we are launching today, and then I will conclude. Now, if you go to the next slide, you realize that the Uganda Insurers Association was formed about 58 years ago in 1965. And really, the mandate is centered on promoting and developing sound insurance and insurance activities in the country. We are a membership body, and we represent our members. And to date, we have about 35 members. We are just a trade association, and we are a voice of the insurance industry in the eyes of the public to our different stakeholders. Now, of course, part of our mandate speaks to us working to encourage and promoting close cooperation. And what have we done in this area? I'll tell you that as we cooperate, as an industry, we've come up with a number of initiatives and platforms. One of those is the Motor Third-Party Platform. Today, if you are purchasing Motor Third-Party, you will simply go to your phone and dial *165# and follow the prompts. This has brought in over 30 billion to the industry. We have now developed a platform under marine insurance. We've also come together in terms of collaboration to offer our capacity as an industry to de-risk the agriculture sector, but also for us to be able to participate in oil and gas. We came up with a consortium, the Insurance Consortium for Oil and Gas Uganda, where we are offering our capacity again to the international oil companies. Now, unfortunately, in promoting close collaboration, in promoting industry initiatives, in ensuring that our members collaborate, we have not fared very well when it comes to medical insurance. So in that area, there are a lot of gaps, and there is a lot of potential in terms of ensuring that our members can collaborate for the benefit of the public. Of course, we undertake research, but also we represent our members to government in terms of lobbying. And I will tell you that one of the challenges that we've faced is the aspect of taxation, especially when it comes to stamp duty. Now, as you all know, medical insurance is member-based. The scheme will have a number of members. According to the law, in terms of stamp duty is supposed to be applicable to a policy of insurance. Now, a policy under medical insurance will have several members. Unfortunately, the interpretation from the URA is that each member must pay stamp duty. Now, of course, this makes medical insurance expensive. And that is something that we are pursuing with the regulators. It's something that we are pursuing with the Uganda Revenue Authority. And it's something that we do as part of representing our members to the different bodies. But we also work with private institutions. And of course, the next slide will try to break down the performance of the industry. Before I go to the performance of the industry, I would want to tell you a little bit about our membership. Of course, I said we are about 35 members. We have non-life insurers who are 21. We have 8 life insurance companies. We do have 4 insurers and 4 micro-insurers. Very interesting to note that over the last about 5 months, we have been able to grow our membership under the micro-insurance category by 50%. So 2 new members came in, that's Core Micro Insurance and Turaco. And again, this speaks to the potential of the market. Now, unfortunately, and when we go into the premium that we write as the insurance industry, you will realize that micro contributes less than 1% in terms of those premiums, despite the fact that the industry is growing. Now, when I specifically look at the medical insurance providers, when you look at the non-life members who are 21, only 4 of them have ventured into medical insurance. 4 out of 21 have ventured into medical insurance. When you look at the life side, only 3 out of the 8 have ventured into medical insurance. Now, of course, on the side of non-life, this represents 19% of my members who are offering medical, and on life, it's 38%. Of course, I have a specialized medical insurer who is Jubilee, and together, there are about 8 participants in this space. Can you imagine that medical insurance that contributes 20% of the premiums that we write as an industry, only 8 of my members are venturing into this space? The question I leave with you is why? Now, of course, when you go to the next slide, you will then get a bit of information in terms of the statistics and the performance of the industry. When you look at the years 2018 to 2022, you will notice that the industry has been able to write about 5.4 trillion. Now, of course, 5.4 trillion, 43% of that has been paid out as claims. And on average, the industry has grown by a rate of about 15%. Now, last year alone, our growth rate was 25%. I will tell you that many of my members on the life side for last year, they grew by about 50%. I have members who grew by about 50%. A lot of my members on the life side. Now, of course, when you look at this growth, when you look at the period 2020 to 2022 and even 2023, especially 2020, which is very significant for us as an industry, where we crossed into the 1 trillion shilling mark, you realize that maybe that is why our industry and as players we've remained comfortable. Maybe this growth that has come over the years has put us in a position where we are comfortable, and therefore we've not been very quick and fast in terms of adopting the use of technology. Because after all, with our current systems, with our current distribution channels, we are enjoying a growth of over 25%. Now, of course, this has caused a bit of challenges when it comes to customers, when it comes to user experience, when it comes to the power that we are putting in the hands of our customers. We have remained largely traditional as a result, and of course, to the detriment of our customer. Now, when you look at just 2023 Q1, and these results, as soon as I leave here, we'll release a detailed report. When you look at just Q1 2023, the industry has grown by about 21%. I will tell you that premiums written are now at 443 billion for the first quarter of 2023. Of course, if we are to go with this trajectory, it means that by the end of the year, we will close at about 1.8 billion. Now, when you do the math, at 20% contribution for medical, you will realize that probably there is about 360 billion that we will write as medical insurers. And this will signify an increment of about 100 billion for this year from the 280 billion that we wrote last year. Now, of course, this speaks to the potential of the industry, but also, as I will be telling you about the challenges and, of course, the issues that we have around medical insurance, medical alone in the first quarter of 2023, its contribution was 85 billion. And this is for my members and the members of the association. This does not include the HMOs, the 2 that we have currently. Now, of course, the potential when it comes to the industry, of course, it's enormous. Now, when you try to dig a little deeper on the next slide about the landscape, the medical insurance landscape, like I mentioned, only 8 players in this space contributing 20%. It's the biggest class of business for us. Now, of course, being the biggest class of business, and as an association, our thinking is that if we are to grow, if we are to increase penetration of insurance, and I know, Judy, you alluded to some of the challenges that we have currently, issues of trust, issues of access, issues of awareness. Medical has the potential to solve all those issues. Because with the medical insurance, if you can access medical insurance, you then get to understand, you then get to test the services of an insurer. Because it's an easier way of testing the service of an insurer. So it's the biggest class, only 8 players, but contributing 20%. Unfortunately, the biggest class also has the highest loss ratios. You can imagine contributing 20%, but with average industry loss ratios of 90%, over 90%. And for some of my members and for some of the schemes, when we dissect it further, the loss ratios are above 100%. If you're a business owner, if you are an investor, does that make sense for you? Would you want to be in this space where the loss ratios are 90%? But also, medical insurance, if you critically look at the numbers, and I'll single out the year 2022, last year, we have a monthly claims payout of 19 billion. Can you imagine that for every single month of 2022, we paid out to the service providers 19 billion? That speaks to the potential of medical insurance. That speaks to the power of the insurer. But also it speaks to the fact that without medical insurance, probably the majority of Ugandans would not be able to, not the majority really, because we cover only 500,000, but the majority of the working population, as players, as insurers, we are doing ourselves a disservice by again also using price. So the industry competes mainly on pricing. Our systems are predominantly manual. Despite the fact that Smart, I think just sometime last year or early this year, you launched the EDI. Despite the fact that you've been able to place so much information in the hands of the insurer, our systems are predominantly manual. And to this, we are losing about 30% of the claims that we are paying. More than 30% is through leakages that are as a result of us being manual and not taking advantage of these systems. Now, when Judy was presenting, she was able to break down a lot of things. She was able to go into the details in terms of geography or geographic spread, in terms of the demographics, in terms of the different minute details. Now, at the level of the association and at the level of the industry, we are working in silos, and as a result, we've not been able to harness the power of that data. And when I present to you, I may not be able to dissect the information the way Judy has dissected it. So for decision-making purposes, we are working in silos, we are working as individual companies, and as a result, we are not data-driven. Now, you can imagine, currently, all of us, including the HMOs, cover only 500,000 Ugandans. And I was speaking to the head of marketing, the group head of marketing, and we had a conversation and we were saying, what is the penetration rate in terms of medical? I think, Harrison, also you alluded to the FSDU report. Again, these statistics, we are at about 1% coverage. Now, if you flip the coin, and of course you talked about anxiety and mental health, if you flip the coin, it depends on your state of wellness. Because 1% to another person could be a great opportunity because 99% is not covered. And I think for me, I would want to stick to the 99%, which is the potential that we can be able to cover. Now, of course, if you look at the supply side, you will agree with me that it is shrinking. We have 8 members, but if you look at the statistics in terms of where we started in terms of the number of HMOs, we are at 2, but at one point we are at about over 5. What has gone wrong? We no longer see microcare, we don't see IAA resolution, we don't see St. Catherine's, and recently IML was also acquired. So on the supply side, it is shrinking. But also there is a bit of pressure in terms of regulation and compliance. Again, when you talk about the requirements of the CAR, that's the capital adequacy ratio of 200%. When you look at the new accounting standards, there is a lot of pressure in the space of insurance, and specifically in medical insurance. And as I go to the next slide, I know, Judy, you've addressed the challenges of medical. And you've highlighted some of the things that I've also pointed out here. But I wanted to tell the delegates this morning that the Uganda Insurers Association, in the space of motor insurance, we almost had identical challenges. Fraud under medical is a big problem, and fraud is perpetrated. All of us are guilty. The insurers are guilty, our members are guilty, the service providers are guilty. You cannot pinpoint a single source of fraud and say it's just simply the service providers. Even us as insurers, there are challenges, and these challenges we all know. I wouldn't want to go into the details. I've talked about the manual nature of doing business. The service providers will attest to the fact that there are delays in them receiving their payments, and this is just simply because of the manual nature of how we are doing things. And I joked at the beginning and said I'd come with a piece of paper. Today, if you walk into any provider's premises, again, you will be required to fill out a form. How can we be operating like that in this period? Now, one of the biggest threats now to medical insurance, and again, this is where we call upon the public, we call upon the service providers. One of the biggest threats we have now is the diminishing reinsurance support. Any insurer in the house will tell you that when we take on a policy, when we take on your scheme as insurers, we will be able to share that risk with a person called a reinsurer. Now, because of the high loss ratios, like I mentioned earlier on, 90% high loss, loss ratios averagely for the industry, over 100% for some of the schemes, the reinsurers have started withdrawing their capacity and support. Without directly mentioning any player, but one of our members this year has stepped off a number of treaties. What that means is that reinsurance is going to become more expensive, and ultimately the primary product and the premium that the public pays will also become expensive. And the reinsurers have come out and been very clear in terms of the changes that they would want to see if they are to continue participating and offering us that much needed support. Because without reinsurance, surely there is no medical underwriter who can survive. And I will tell you that at the heart of their proposals is automation and digitization. Now, of course, I don't want to go into the frequent hospital visits. That is a known fact. The issue of placement of business by the insured based on mainly costs. We do not ensure that our members understand the model and medical insurance, because medical insurance is still insurance. But what has happened lately is that the public and our members, because we've not sensitized them, because we've not given them the power to manage their benefits, to manage the product, it is no longer insurance that we are offering, but simply a person who feels like visiting a hospital will visit at any one time without necessarily that being an unpredictable event. Even when I sneeze, the next minute I'm thinking about my smart card to be able to walk into a hospital. That's not insurance. So again, we lack the understanding of medical insurance, the public lacks the understanding of medical insurance, but also because as providers, as insurers, we have kept a lot of information to ourselves. We've not empowered our members and those that we insure. Of course, the issue of sensitization, and I know, Judy, you alluded to it, even at the larger scale beyond medical, that we are not doing well when it comes to sensitization. My question is, how much sensitization is enough? When you look around, all the key players, including SMART, are involved in sensitization. At what point do we now say we have had enough sensitization. That is a discussion we'll have for another day. Now, of course, unethical practices, we all know, and also the very high prices of drugs and services, and the lack of standardization. Now, I will tell you that when you compare medical insurance under the motto third-party product, almost the challenges are identical. We had issues of fraud. The stickers were being printed down here on Nasa Road. We had agents running away with premiums. We had issues of lack of standardization in terms of price, despite the fact that the product was standard. But all these issues were solved by a platform. So when we came up with an MTP platform, all these issues were solved. I am glad that this morning we are embarking on the journey to try and solve the challenges in medical using the SMART option. Because every single thing I've highlighted, if you are keen in terms of the presentation that Judy gave us, and I know later on we'll go into the different facets of the solution, the virtual solution, you will realize that all these are solutions to the challenges that we have under medical. And I would not be in a happier space than this one, where we begin to see the light at the end of the tunnel, and of course where we as insurers sit in a space and say, do we want to take this direction, or do we want to remain and maintain the high loss ratios that we do have? Now, of course, as we all sit here, the UIA and SMART, and I've identified a number of areas of collaboration and partnership. But the next slide will show you specifically some of the things that we think are key and crucial or low-hanging fruits that we can begin with in this partnership together with SMART. Now, of course, like I mentioned, the aspect of automating and digitizing our members is crucial. And I would want to commit on behalf of the association that we will support and sit with SMART to ensure that this solution does not only end here at the launch, but we give them an opportunity to meet our members, to interact with our members, for them to understand in detail how this solution can be able to help in terms of the challenges that they face. At the level of the association, I mentioned the issue of data. Now, my role as the leader of the UIA, the majority of the time, I am using my mouth to speak and read the information of insurance to represent the different players who are my members, but I need to be equipped with information. If I don't have information, if I don't have statistics, I cannot ably represent my members. Now, I see a potential here that through the SMART solution, we can be able to start working on the data. The data that Judy showed you here is important data for my stakeholders. It is data that I don't have, but probably it's data that they have independently. But of what use is data if the industry is not aware, if the public is not aware? Some of the challenges we have under medical insurance are behavioral. Data can be able to assist us in terms of tackling these behavioral challenges. The issue that we have, recently we came up with a number of solutions together with the regulator, and I was joking with Harrison last evening, and one of the things the regulator was proposing was that we come up with a key facts document that would summarize the benefits under medical insurance and display these at the different service provider points. Can you imagine in this day and age where 80% of the population, or 84% by 2025 in Africa will have a mobile phone, we still want to walk into a service provider premises and our members read a key facts document that summarizes some of the benefits that are accruing to the card that they hold? It cannot work. And to be honest with you, we failed to implement it. So the issue of data generation, analysis, and presentation. Because without data, we are just simply expressing an opinion. If we are to go and interact with government, if we are to go and interact with the public, if we are to interact with the service providers, we need data. And that data is where we want to begin with SMART, so that the industry can be able to share this data, the industry can be able to use this data. And I would want to close, I've used longer than my time. But also the issue of stakeholder empowerment. Now, I am glad that the SMART application option is empowering all the key stakeholders within the ecosystem, the medical ecosystem, including the members. Talk about utilization, talk about balances, member information. How do we ensure that the members are equipped with information? One of the challenges we've faced as medical insurance providers is that 70% of the people we cover are dependents. We don't even have access to them. It's only 30% that we can access. The 70 who are driving our costs up, we cannot access them. What better way than to use technology? Look at research and collaboration for better products and services, and this will be driven by data. I am sure that we can be able to release journals, release reports together with SMART as an industry for the betterment of what we do. And as I conclude, on the next slide, I will leave you with this statement, that the sustainability of medical insurance depends collectively on all of us working together through digitization and automation. The sustainability. We must work together to sustain this business. If the service provider still needs the 19 billion, we must work together. If the insurer still needs to collect the 360 billion, we must work together, collectively, to sustain this business. Of course, once we do that through digitization and automation, it will feed into low claims ratios, timely payments, appropriate pricing, better packages, empowered customers, and a decent return on investment for the shareholder. Ladies and gentlemen, I want to thank you for listening to me. I hope that with those few remarks, you've been able to understand the landscape, the industry, and the challenges that we are facing. And I look forward to unpacking the virtual card so that it feeds right into the challenges that we have as an industry. Thank you again.
Ladies and gentlemen, energy meets energy. If you noticed how Jonan presented, I think he deserves a bigger round of applause. For those of you that don't know Jonan, you can easily confuse two things. You can confuse passion for anger. So if you don't know Jonan, you'd think that if you annoyed him, he'd be very terrible with his anger. But allow me to tell you that that is how Jonan is very passionate about technology and growing the insurance sector. So we need to give him a big round of applause. I noticed that because of the breakfast, and Harrison and Judy, we talked about this. Because of the breakfast, I noticed that where it is critical to clap, the breakfast has overshadowed our clapping. Because Jonan mentioned, and I expected that we were going to clap, almost stand up. Jonan said that he commits that they will create a platform through which SMART continuously interacts with the insurance sector, and these are his members, to digitize. You think that doesn't deserve a big clap? Because he's providing, because we are talking about digitizing. And he himself talked about papers. And of course, when I was going back there, I also noticed that I have papers. But me, it's because of how I grew up. When I was growing up, my parents, even when they were sending me to the shop, they used to give me papers. Because they used to tell me, Gava, you will forget. They write, buy 2 kilos of sugar and come back. So I would not make any error. But the committing to ensure that the insurance sector indeed digitizes is a big, big statement. And John, thank you very much. John alluded to a number of things. How medical is the largest, but also is loss-making. And of course, this to a certain extent is going to be solved by the application. And in my thinking, Harrison and Judy, together with the entire SMART team, this application, like Jonan said, is not going to end here. And in my thinking, I was thinking, as someone starts to use the application in the year, can the application start to change colors from maybe yellow to green to red, so that as someone starts to consume insurance, somehow they know, as my application turns to red, I am overly consuming, there is a problem. Because so many Ugandans out there, once they go to hospital, of course, when I was telling me about the application, I was thinking, what is it going to do? So many Ugandans out there think that the medical card is sort of like an ATM. Once they tell them that you have 20 million, they really see money for using. So some of them, with their small families, they've bought their small car. On Sunday is a hospital visit. So even anyone who complained about headache, anyone who sneezed through the week, jump into the car, we visit hospital. And they don't only visit hospital 1. They go from hospital 1, they get treatment. Hospital 2, they get treatment. Hospital 3, they get what? So, Judy, we need to investigate how the application needs to change color, so that an ordinary Ugandan starts to know that as the color turns to red, I am being marked, that my people are over visiting the hospital. I'm not a tech guy. I'm thinking outside the box. Because when I was speaking, Judy was wondering, tech people will handle. But friends, I think it's an exciting time to live. And Jonah, thank you very much for sharing the statistics in terms of how the sector is performing, but also the challenges. But like Harrison said, it is a good time to live now because the solutions are alive and well. Ladies and gentlemen, at the beginning of this conversation, I talked about our partners. I talked about Millennium Optics. I talked about C-Care. I talked about Maristops. I talked about AR. And I think we need to give them a big round of applause. These partners have brought us hampers. In a layman understanding, when you talk about hampers, people expect to get bread, sugar, medical hampers. These are medical hampers. So I know that many of us may not access this platform while we're still in this meeting. So what we're going to do, we have a Raffle draw supported by the partners that I talked about. And like I said, if Jesus is with you today, you are going to win something. Tell your neighbor, if Jesus is with you today, you are going to win something. After telling your neighbor, add on this statement, but if you do not win today, we still love you. We still love you. So friends, I am going to be moving around, and I'm going to do this in a minute to make sure that some of us that are not enjoying these lights have the ability to enjoy these lights. So I'm going to look out for 16 people on this table who wants to be a lucky winner. This is how people want to go to heaven, but they don't want to die. I've asked who wants to be a lucky winner. Put up your hand. I think this table, no one wants to win. Let me go this side. Put down your number. Put down your number. Please rise. The number I give you is the one you pick. Pick the number. Move to the stage. Next person. Sir, you also want to win. Pick a number. Move to the stage. Please don't confuse the ballot. Don't put it in the pocket. Move to the stage. That's why I said pick the number. Stay holding it. Don't mix it with yours. These people who want to confuse the raffle. Move to the stage right there where the cameras are seeing you. Please don't confuse our numbers. The number I give you is the number you pick. On this table now you have thought about it? Okay, thank you very much. Move to the stage. Here, who wants to win? Okay, pick a number. Not yours, pick a number here. Move to the stage and hold that number. Please make sure the number I've given you, you're displaying it to the people because the cameras are going to be seeing. Eh? Please move. If you want to win, you put up your hand and I come to your table. I see that there are more men that want to win than ladies. I'm sure that, how many people are those? I need to make a good number, total number of 16 people. You want to win. Huh? People are pointing. It's not me who wants to win, it's her. Please move to the stage. The numbers I've given you are the ones you should be holding. Do you want to enjoy the beautiful lights at the stage? You can't stand there. Some of you have been saying, the guy is black. No, he's brown. It's the lights that are confusing you. So go there. Even you people will confuse you to think you're black, compare you're brown. Okay, pick a number. This table, who wants to win? This table, who wants to win? No one wants to win. Okay, there are some people who are saying, not me, because it involves going in front. You're busy saying, people are looking at me. How many people are those so far? If you did quick math, how many people are those so far? I don't want to go beyond the number. How many? 10, eh? You want to win by mistake? You want to win? Let me go here. There are some people, when I reach their table, they put their heads down. I don't know why, people. How many are those so far? How many? 11. So plus others are 12. I need 4 more. 4 more, anyone? You want to win? Anyone? You want to win? There's this one. But the men point at the ladies. Then the ladies don't point at the men. How many? Please move to the stage as I've given you the numbers. Please move to the stage. Ladies and gentlemen, let's give these people a round of applause because they may have picked your number. I'm seeing now some of you are saying, this is not mine. This is when you know that you didn't pray enough. So are these 16 people? Because they should be 16. Exactly. So you move here, you mention the number that you have picked. And if you are the lucky winner, you come to this person. If it's your number, you are not the person. You can't have picked your number. How? But anyway, please move. The number that you have picked.
The number is 25.
25. People, we gave you tickets. Don't clap for people because they may not be here. We gave you tickets. If you have 25, please raise your hand. The one you picked is having breakfast. Come, please, for you, don't leave. Next number.
The number is 150.
150. Please also read the partner.
Millennium Dental.
Millennium Dental. Okay. 150 is around. Okay. Judy, I hope the numbers we gave are those that the people have. Because the people may have also got other numbers, but okay. Next.
The number is 280.
280. People, check your numbers. 280.
Smart.
280. First, forget the partner. Now I'll read the partner when the person is here. Go back. How unlucky would the three of you be? You pick a number, the people are not there, it is not you.
The number is 100.
100. 100. But people, are you checking your numbers? Or you were virtually remembering them? Because now some of you become intelligent. When they talk about virtual, you want everything to be in virtual. Put your numbers there and look at them. Or are they yours? No, they don't. They are not. Next.
Good morning.
Morning.
The number is 80. Millennium Optics.
80. What a day. But you will not say we didn't give you. We wanted you to win. You were not lucky enough. The number?
Good morning. The number is 119.
119. What a wow.
The number is 20.
20.
We are now soon asking you, which numbers do you have so we read those? We are about to get to that level. Because I can't do half of the crew that I brought, where I expect that people are super with picking numbers, and none of you is winning. Please read the number.
Good morning. The number is 110.
110. But did you pick numbers anyway? No. You picked, eh? Okay. Yeah. Now, these are the virtual people I was talking about. So what's your number? 1? Let's clap for our first lucky winner. Sir, please come to the front. I was almost calling the Pameras and telling them, Pamela, what did we do? So where is verify this number? No. The one for 110. Please come. Verify this number. That it is his.
Yes.
So, sir, for you, you have been relieved of your duties. Thank you very much. Give him a handshake. Give him a handshake. Tell him it is your day. Okay, so, sir, Millennium Dental has got you covered. Thank you. So the team over there, the smart team, you look for Pamela, you look for Sharon, they will guide you on what Millennium Dental is going to do with your canine. You know premolar? All right, go. They will tell you what they are going to do with your molars, premolars. Smart team, please, Pamela, handle this gentleman accordingly. Our first winner for the day.
So the number is 3, Sikaya.
3. 3, no one. Next.
The number is 10.
10. Thank you.
The number is 164.
164. You are sure? We are not saying 146. Error of omission. It is 164. It is you. Let's clap for this beautiful lady. That's the day when Jesus has remembered you. So this is 164, you confirm? Because this is a lady like you, give her a hug. Okay. Just like the other brother, Millennium Dental is going to do what we call teeth whitening. Teeth what? Whitening. If you don't want, you show them a premolar or molar that needs fixing. Clap for Millennium Dental. Pamela, please handle accordingly. Next.
The number is 50.
Okay, please come. So the number we read, still the person is not here. First, wait. I need to be sure before you read. There are some people that look at you and you wonder if it's you who told them to pick a number. Sir, with the way you are looking at me, which number did you pick? Because it's as if you were annoyed with me that we are not reading your number. You're not, eh? That's your serious look. Okay. He's just passionate, eh? Okay. Because he was looking at me, and then I was wondering, am I the one who told you to pick a number? Please read the number.
The number is 30.
30. Okay, please go. Next.
The number is 200.
200. Thank you. Is that you? The way you were standing up is as if you are not happy. Come as if you are sure. Someone stands up as if they are writing a comma. The one of 200, please come. Please verify that that's the number. Show her. It's the one, eh? Because this is not your brother. It's formal. Give him a handshake. Handshake. Arm's distance. Sir, you are very humble. You are going to win. So still, Millennium Dental. Millennium what? Millennium. Do you have dental problems? Do you have a family? You don't have, you are single. You are going to enjoy the better. We had the fear that you will bring all your family members to Millennium Dental. It's only you. Thank you. Clap for our third winner for the day.
The number is 33.
33. No one. And finally,
120.
120. Can we clap for these people? They have tried to pick your numbers. It is just that it didn't work. I need 2 people who thought that their numbers are part of these. You put up your hands. 2 people from the audience. 2 people. If you thought that indeed my number today is the day. None of you. Please come, please come. I will only pick those who are sure. If you knew that today was your day, please come. Please come. Please come. So let's extend a bit and allow these 2 people. Can we clap for these 2 people? Who, when they were coming here, they knew that they had to win something. Okay, join there. Ladies and gentlemen, these 2 are winners, but also Smart Applications has told me that because you were not lucky in picking, they have said you are going to take something in your being unlucky. Your smile says you don't want to win. You want, eh? Can I now invite the CEOs? I am going to invite the Millennium Optics and Millennium Dental, Dr. Lalani, Mohsin, and then Dr. Salim to join me here at the stage. I'm also going to invite my good friend Harrison, the Group Managing Director, please come. And then we also have CK, Dr. Miriam, please come. Can we clap for the CEOs that have joined us on stage? So I am going to request that you pick. I will not say, of course, for everyone to put out their teeth to see those who have teeth problems. But I'm just going to give you a room to give to the people that are on stage. Let me first to pick which ones of these do you want to win? Dr. Miriam, is what you want. Or please go to Dr. Miriam. Please go there for a handshake. Pamela, I don't know how you're taking stock of this. There are different winners. After they come there, Pamela, should they come there after? You bring the hampers here. Dr. Miriam, please step up the stage. And the rest of us, let us keep smiling as we ready ourselves. Because the picture will find you. So you hand over. So I have been informed that your choice is what is coming next. Just receive a handshake and we write your name. You're going to get from CK. It's here. It has arrived. The Lord has remembered you. Not all. People, this winning thing. Group picture. Can we clap for our winner? There are some of you who are seated there and you're not happy for this ceremony. I have round 2. I have what? Tell your neighbor I have round what? Round 2. But we are still continuing with the program. After this, we are going to launch the application and I want to move very fast. Next person, please come. What do you want to win? Is it AAR, is it dental or optics? Which one do you want? Dental. Dental, please. You move to dental. The dental person, you move to the front. Here, what you ask for is what I give you. This business of we give you what you don't want. Madam, you come very fast. We have no time. We have dental, optics, ARC care. Everyone has a dental problem. Okay, can you clap? It simply means dental may get over before anything. Please come. Please note that it's not new tooth. It is just checking. You may go there and ask for a new tooth. Please come. What do you want? I have CK, AAR, dental, optical. Optical. Optical for you or for your mother? We are saying for you. Let's clap for these people, friends, as they come. Next, very, very fast. Your choice. You are lost of choice. Let me give you your AAR, general. General, you go there, AAR. AAR not here. I had AAR here. Please come and hand over. You want us to give away your things which you gave us? Let's clap for representative of AAR. Okay. You go there. and give. The reason we are taking a picture is that tomorrow you don't change your mind. We didn't give. Next, please come. Yes, please. Which one do you want? Dental, optical, AR, C-care? C-care it is, you receive. Dr. Miriam, I'm sure I'll just come and we talk. Don't have to be in the hamper line. Next. Very, very fast. Optical it is. Optical. Please move there to optical. Next, sir. Dental. Okay. Please move. Next. You're not seeing anything for smart. Oh, Baba. Pamela, this is for smart. I was not going to talk about this, but this man has pushed me. Because this is big. Who is going to award for smart? Hey, Harrison. I think this man knew what is in here. Because the way he had it, I'm not seeing anything. But even me, I had privately put it under to say that now, since all of you are over. But this man, he came when, I think you had the prior notes to this. Okay. Next, please. C-care, okay. People, I hope you're not picking your employers. Okay, yes, please. C-care. The rest of us who are picking C-care is over. People, let's clap for Dr. Miriam. I think C-care has done us well. Next, please. C-care is over, but I have AAR. I have data and optical. Okay, but you can also go back and win in next round. Which one is okay for you? Next round, eh? You will do dental. I knew. You will do dental. Dental is a big problem. Please come. Which one you want? Dental. Okay? Please note it's for you, not boyfriend. I need to be sure. Please come next. Dental. Optical. Okay. I need 2 more lucky winners to close the first round. 2 more lucky winners. Please come, please come, please come. I need people who are ready. Ready. Come here. You are not CEOs. Come in the front. So for you to win, I'm going to ask you a scientific question. And if you give a wrong answer, you walk back. So officially, not when you officially, church knows and your parents. You have visited their home. I was going to give you two, but if you're not officially married, it's no. People, and I may not have the appropriate answers. Can we clap for the CEOs, ladies and gentlemen? CEOs, thank you very much for doing us the honors. And like I said, this is a session. We still have more gifts to give away. But at this point in time, because of time, allow me jump into the Smart Access demo, which is a video to show you the benefits and the value proposition. And at this point, I'll request the team we worked with, Kadanke, to take us through the journey of the Smart Access presentation. Friends, to show you the benefits and what we have in stock for you.
Are you tired of the hassles that come with managing your medical cover? Introducing the Smart Access Virtual Experience, the revolutionary solution that brings convenience and peace of mind to your healthcare journey.
Can we dim the lights
with
and
Smart
rerun the video?
Access, you can embrace a world of effortless healthcare management. Let's explore the incredible benefits of Smart Access. Benefit 1. No worries about losing your medical card. Say goodbye to the fear of losing your medical card. With Smart Access, everything is virtual, secure, and always at your fingertips. Benefit 2. instant access to your medical insurance policy. Signing up to access your medical insurance policy has never been easier. With Smart Access, you can complete the entire process instantly, right from the comfort of your own device. Benefit 3. Know your medical cover balance. Smart Access empowers you with knowledge. You can easily access and assess your medical cover balance, allowing you to make informed decisions about your healthcare expenses. Benefit 4. Tracking your medical cover utilization. Smart Access keeps you organized. It tracks and manages your medical cover utilization, making it effortless to stay on top of your healthcare spending for both you and your family members. Benefit 5. Locating medical providers in your area. Finding the right medical provider is a breeze. Smart Access lets you browse and explore a vast network of medical providers in your area, complete with their geographical locations, so you can choose the best care for you and your loved ones. Benefit 6. Initiating hospital visits. No more waiting in long lines or going through complicated processes to see the doctor. With Smart Access, you can initiate hospital visits directly from the app, saving you time and hassle. Benefit 7. Reading inspiring stories about health. And finally, Smart Access goes beyond the practical aspects. It also brings you inspiring stories about health, empowering and motivating you on your wellness journey. The Smart Access virtual experience revolutionizes the way you manage your healthcare. Say goodbye to worries, embrace convenience, and take control of your well-being. Get started with Smart Access today and unlock a world of seamless healthcare access. Smart Access Virtual Experience. Anytime, anywhere.
Ladies and gentlemen, can I request that we give another round of applause? I think that the solution has been ably read. Of course, for me, I talked about visiting. I like the fact that it has a geolocator where you can be able to see a number of hospitals around you. My only worry, and I'm not sure if any of us has tried using Google Maps. Have you used Google Maps in Uganda and you end up in a hill? And where you are going is behind the hill. So we have a bit of challenges, but I think we'll overcome. We'll overcome. And of course, now one of the other things that the app probably may not take care of, especially in locating the hospital, it may not show you how many potholes are in a given road and how much time, because it will anticipate that maybe you'll take about 30 minutes. But if you think about it, where there are potholes, you may take 2 hours. But nonetheless, I think we're getting there. The medical bills is what we talked about, and I like the fact that it shows you. And of course, like I said, Harrison, how does it start to flag to make sure that people are cognizant? Friends, I was saying that text sometimes can be very interesting, because once you use certain decisions, say, okay, we are going to pass here and pass here, then you locate the hospital. But when it gets to utilization, it has to flag some of us, because some of us look at it as ATM and you want to pick money and swipe and swipe and swipe and swipe, which becomes a big challenge. But I like the fact that the solution is intense, and like I said, we still have more gifts to give away. I'll be coming back to round 2 because you see there are more numbers in here to pick. I hope you're excited about it. If you haven't picked your breakfast and have just joined us, please feel free to pick something for breakfast as we continue on the launch. Friends, on the tables are umbrellas, if I should, for lack of a better word. And these should be able to show you the journey. I'm sure that all of you have phones because now we are getting into the launch. And I want to make sure that all of you enjoy the launch. And of course, I'll invite the table where Harrison is seated, where Solomon is seated. Jonan is going to be our chief launcher. And so our guest of honor, you'll jump on the stage together with the rest of the team, and we launch this. But just to make sure that all of us are on the same page, Friends, there's an umbrella, more like a paper that has a scanner, and we should be able to take it around the table. This over here, let's first of all make sure that we are scanning. It is irrespective of the phone type that you are holding. It should be able to scan. But for some phones in the camera, it may not give you access, so you may have to download a QR scanner. So if your phone, if you put your camera there and in 5 seconds it is not reading, you are holding a phone that can't read. Just download the scanner, and then it should be able to take you to the space where you should be able to get the application. It is very, very important for everyone in this room to know how to contribute in the subject matter. And how do you contribute to the subject matter? Get online, get on Twitter, get on Facebook, get on Instagram, get on all the channels that are there to make sure that you're tweeting about the conversation, you're Facebooking about the conversation. So get into those spaces. For one time, if you're using WhatsApp, because WhatsApp now is heavily visible by so many of your people in your contacts, at least take a picture of the virtual app and then be able to share with your audience. Friends, I hope that you have downloaded the Kadanke team. I need a thumbs up to show that we are ready. Thank you very much. At this point in time, ladies and gentlemen, we are heading into the launch. I don't hear the excitement into the room. Ladies and gentlemen, we are heading into the launch. Okay, friends, so we'll have a countdown by our tech team, and once the countdown is done, we will then have a fingerprint, and it will open once we see the application interface. I request all of us to rise, clap, and ululate. Do we have a Musoga in the room? Basoga are very good with that kaluru. The Baganda, I worry because sometimes they do a kaluru for thieves. But can I invite... They're not very good with that kaluru. Can I invite Harrison? Can I invite Solomon? Can I invite our keynote address, Jonan, together with the entire team to come up front? And they should be joined by Dr. Andabad Gonzaga. Please come on and join the team up here. Can I also invite the representative of Self for Health, Mr. Frederick Makaire, to also join the team as we indeed do the launch. I request the SMART team to get me my placard to the front as we prepare to proceed with the launch. Friends, after the countdown, you will see that Jonan's finger will be right there. And once we see the interface, let us rise, let us volulate and clap for this momentous occasion. So what do we do? You're joining Jonan here. Jonan, the countdown will be there, and then you put your thumbprint on the screen, yes. And then after that, the interface will show, and then people will volulate. Thank you very much. So, just a minute. Before we do the launch, allow me to invite Esther to just say a word, and then we do the launch. Please welcome Esther with a round of applause.
Good morning, everyone. Good morning again. Please wave. It's a very big day this morning. I'm very happy and honored to be here and to stand among us, all of us. Thank you for your patronage. This morning marks a very big event for SMART. We are happy to be here and to be launching this particular product called Smart Access that I know by the end of this day, all of us will have it on their phone. Yes, it is geared to ensure that indeed we accelerate access to healthcare by ensuring that now access is purely on your fingertips. What you used to have before, where if you forget your card, you would not even go back for it. Yes, 80% of all of us have access to a mobile phone. Yes, and we endeavor to ensure that we bring this closer home in terms of access. And this morning, we are very happy to be formally and officially launching Smart Access in Uganda. Thank you.
So John, and now is the time that Yowa Chigalo is going to do the magic. Jonan and team. Friends, I don't know if you noticed at one point Jonan was not sure if it's his finger that was to unlock. But can I request Jonan and the team to come to the front and we hold this and make sure that it's a representation of what we have done. As you can note, we knew that the people we are working with are tall enough, and so we did a placard that is almost equivalent. So this is a signification of what we have done today in terms of pictorial moment. Can I request even those with earphones to take this picture, post it on your status? This conversation has to go beyond this room because the users of the application are beyond the people that are with us here. So team, I'm going to request that we show a sign that the virtual app is here with our hands. Exactly. Exactly. Thank you very much. I'll request Judy and Harrison to stay. For the rest of the team, can you give them a big round of applause? This is the only time you can tell your bosses to stay and you have a picture with them. Thank you very much. Thank you very much. Can we give Judy and Harrison a big round of applause? Thank you very much. Can I now request the gentleman we worked with to pick this? So move it around and people take pictures with it. Give it to only tall people. Friends, our time is fast spent, but I want to know if you have been able to log in. Has anyone logged in? Because we have launched. I need to see if some hands. Has anyone been able to download by show of hands? Has anyone been able to download by show of hands? On your table, if anyone has been able to download. This side, I'm not seeing anyone. Have you been able to download? Okay, can we clap for ourselves? Can we clap for ourselves? In the event that your neighbor is failing, please support them to see that they download the application. At this point in time, friends, we're going to have a panel session. And I'll request for an interlude from the Kadanke team. You can play some of our partners' videos as I get to invite the panel team here. Kadanke, give me an interlude as I get to ensure that our panel team is set.
Millennium Optics. We started our journey at Johnson Street in 2015 and expanded to various branches across Kampala, the latest one being Forest Mall. You can also find us in Upcountry, Lira, Gulu, Jinja, Bale, and Tebe. We offer computerized eye testing and contact lens fitting at all our branches in-house. We also do outreaches and accept major insurance cards. We are open from 9 a.m. to 6 p.m. Monday to Saturday. Akamvesi Mall branch works on Sundays also, 10 a.m. to 5 p.m. You can come in and have your eyes tested. Also find a huge range of frames, lenses, contact lenses, sunglasses. We also do optical repairs. Come and have your eyes tested at Millennium Optics. Vision for better life. Hi, my name is Mohsin Lalani.
Hi, I'm Dr. Salima Lalani, Head Dental Surgeon at Millennium Dental Studio. We are located at Forest Mall, Block B, first floor, opposite Samsung. We are here to help you with all your dental needs. That includes generalized and specialized dental needs, which is consultation, X-ray, root canals, fillings, simple and complicated dental extractions, teeth cleaning and teeth whitening. We also cater for orthodontic treatment and implants. We are here to help you with all your dental needs. We are open from Monday to Saturday, 9 a.m. to 6 p.m. You're welcome at Millennium Dental Studio, where your smile is our passion.
For over 30 years, Mary Stops Uganda has consistently delivered high-quality sexual and reproductive health services to Ugandans. We deliver health services through various channels, including our 15 clinics, which offer general health care, sexual and reproductive health, antenatal care, and family planning. We are evolving to serve you better through our new highly specialized hospital and maternity located at Lugogo Forest Mall. The hospital adds to our nationwide portfolio of 15 clinics and exemplifies our evolution to walk with a woman, her health journey, from the menarche through childbirth to menopause. Our range of client-centered services include maternity services, antenatal, delivery, and postnatal care. To support safe delivery, the Mary Stops Hospital and Maternity offers maternity obstetric services, including antenatal care, exceptional delivery care, and postnatal care. We also provide newborn and infant care, including vaccinations, gynecological services, including treatment of fibroids, infertility evaluation and management, cervical cancer screening, and treatment of precancerous lesions. Services including family planning, post-abortion care, and management of STIs. General outpatient care including COVID testing, comprehensive laboratory services, diagnostic scans including 3D. We are open 24/7 and have a standby state-of-the-art ambulance to respond to emergencies. Our contact center team is on hand to receive your calls toll-free, provide information, book your appointments, and follow you out. For more information, call our toll-free number on 080-022-0333 or contact us through our website on www.marystops.or.ug. Visit us today to experience exceptional healthcare. For over 30 years.
Ladies and gentlemen, those are the videos of our partners. Because of our program, friends, we need to run. So at this point in time, we're going to have a panel session on leveraging on digital systems to drive healthcare business processes. To lead the panel, who is our key moderator, this is a gentleman with 38 years of experience in insurance. He is a member and pioneer board of Uganda Insurance Commission, which was now renamed as the Insurance Regulatory Authority of Uganda. He is a past chairman of Uganda Insurers Association, a past president of the Insurance Institute of Uganda, a past member of a high-level advocacy task force private sector foundation in Uganda, and his last posting as the Chief Operation Officer of Gold Star Insurance Company between 2014 to 2020. He was a member of Governing Council of the Insurance Institute of Uganda, currently the Insurance Training College. He is the chairman of the Insurance Brokers Association. He is a proud member of Rotary Club of Muyenga, and he is a Paul Harris Fellow. Friends, can we welcome Solomon Wondo, our moderator.
Good morning, ladies and gentlemen, and thank you very much, Gava. May I request us to stand up? To enjoy this panel discussion, we must be fit. Stand up and have enough space around you. Because you've been sitting for most of the time, Gava dominated the stage. Now that I also have some authority over you, I'll invite you to follow me so that we put medical access into perspective. All right, if you have enough space around you, check the right or check the left, check behind, check the front, all right? Okay, you know your Christian names or Muslim names, so I'll ask you to use your body, the body. You can use the foot, you can use the waist, you can use the head, but after writing your name, you just put a full stop by stamping the ground with both feet, okay? How do we stamp with both feet? Can you show them? Exactly. Okay, at the count of 3, write your first name, your Christian or Islamic name, and then put a full stop at the end of your name. 1, 2, 3, let's go. Your names are that long. Okay, at the count of 3, let all of us give a full stop. I'm sure you have written. At the count of 3, 1, 2, 3. Take your seats. Thank you very much, ladies and gentlemen. Today is World Pressure Day. May I request those of you who did a pressure test this morning to stand up. If you're sure you did a pressure test, you know your pressure level this morning, please stand up. Because we are speaking medical, we have to use medical language. If you did a pressure test this morning, please stand up. Thank you very much for your honesty. My pressure was 122/83 at the pulse of 78 average. Is that normal? Should I proceed? Doctors in the house. My pressure reading is 122/83 at a pulse of 78. Should I proceed? Can't you clap for me then? Welcome to this noble occasion of the Smart Partnership launch. We are discussing a very interesting subject. We are discussing a product issued by insurers who don't deliver it. They sell medical insurance, but they're not the doctors. They sell medical insurance now to individuals, but previously to organizations who don't use it, but just the individuals. Which brings into perspective a very important player, that is the actual consumer. The consumer has his challenges, which Smart Partnership, Smart Access has endeavored to address. I like the statements. When they say last, they always say last but not least. Gava, I also wanted to challenge the audience, because when they presented some of the challenges, then I also remembered first and foremost. And what was first and foremost? What was first and foremost? Huh? I hear the word. I hear the word. The word was fraud. And this reminds me of a lady who was the corporation secretary of a big organization. And during COVID, she said, I don't have anywhere to go to replenish my stock of cosmetics and perfumes. Can I use my medical card to get these from the pharmacy? If you want to understand what fraud is. Smart Access is obsessed with the challenge to digitize accessibility and affordability. But I was intrigued when I saw the numbers and I saw the results of their intervention. And they said, because of the intervention, traffic has increased, value has increased, but cost has come down. How does that happen? I am happy to hear that there are more people using medical insurance or medical facilities, and I think that's what increase in traffic symbolizes. Am I right? Then they also say the value has increased. It means the doctors are making more money, but the cost has come down. I think it underpins the fact that this system has curbed fraud. It has managed cost. So what is the trigger for us this morning? That are we selling the right products at the right cost and efficiently? So far, I want to believe it is yes, but I was trained to say yes and no. And a no bit is going to be answered by the humble and noble gentleman and lady I am going to invite here. So our trigger this morning is cost, efficiency, and relevance of products. We have representatives from government, we have representatives from players who are going to help me handle this discussion in the next 30 minutes. But to you, smart, I want to say you've answered the first part of the question because it reminds me what my trainer in management told me, that for management to be successful, you must be a manager. And that you cannot manage what you cannot control. And you can't control what you cannot count. So if we're able to count, we're able to control. If we're able to control, then we are all successful managers. And again, I was told that you never repeat anybody's information unless there has been a mistake. A Mr. has been addressed as a Mrs., or a Mrs. has been addressed as a mistress. So I had you ask questions about, are you married, girlfriend, and I don't want to go there. And because of time, allow me to respect the biodata that has been given about our people, because we don't have the time. I guess you have read it. They are well read. There are authorities in this area. And since this is written, we are going to be referring to this as they discuss, as they go on. Are we agreed? Are we agreed on that? Can we have a round of applause to honor these people for that authority? Allow me invite on the stage, therefore, our first panelist this morning, Madame Esther Mwiruri. Allow me then invite the second panelist, our second panelist this morning, Dr. Andabati Gonzaga. A louder round of applause because he said I was normal. He's the one who gave me a clean bin of health. Thank you very much, Dr. Gonzaga. The third panelist is Mr. Paul Mbaka. Mr. Paul Mbaka, please join us here. And the fourth panelist is Mr. Frederick Makaire. I hear their clap fading as if the breakfast is running out. We are moving close to lunch. But I want you to encourage these people. I want you to applaud them so that they are motivated. Welcome, ladies and gentlemen. Thank you very much for joining me. Mine is not to address. Mine is not to speak. Mine is to make sure that you tell the people what there is to know. Good morning once again. Good morning, Mr. Mbaka. And I'll start with Esther. Esther, what is the impact of leveraging on data analytics to drive business decisions. Just press that switch and tell us what there is for us this morning. Over to you, Esther.
Thank you so much, Simon, for that very good question. In terms of data, we all know that the importance of data cannot be ignored in the times you're living in. Data is very critical in terms of being able to provide us with patterns and trends to be able to show what is happening. For example, in the healthcare space, what we have done here at SMART is through what we are receiving as data. This can be used by actuaries to be able to inform pricing of products, as well as where to be able to share or send patients to access healthcare. So it's very important to be able to analyze data and be able to use data to inform and provide decisions that can be able to better the profits coming through various organizations covered within here and outside.
Thank you very much, Esther. Indeed, you can't manage what you can't control, and you can't control what you can't count. You have really underscored the importance of leveraging of data. Mr. Paul Mbaka, in your opinion, what are the tangible efforts by the government in creating and supporting stronger digital health systems and commitments thereof? Mr. Paul Mbaka. He's not here? Mr. Fred Makaire. That's you. Yes, I wanted to do right and left, okay? So, Mr. Makaire, from the microinsurance perspective, what would be some of the critical learnings and recommendations for technology adoption in the management of schemes and the end-to-end claims processes?
Thank you so much, and good morning, everyone. Before I respond, maybe I request you allow me 1 minute just to explain where I come from so that people will get my perspective properly. So I come from community-based health insurance. So this is where my perspective is going to be best. Community-based health insurance schemes are micro insurance schemes, but mainly targeting the low-income families, mainly in the informal sector. And these are grouped around communities that share something in common. They collect some small premiums, put them in a pool, and then use those to access healthcare services whenever they are sick or not feeling well. So coming from the community-based insurance schemes, probably we are not the kind of category that most of you come from, the commercial insurances or the private health insurances. We target really low-income people, and the premiums are averaging around 20,000 shillings per person per year, and those that pay a lot could not exceed 50,000 shillings per person per year. And we want to thank so much SMART for having recognized us, even if we are targeting those kind of populations that are low income, that otherwise would never imagine also having to use technology. But SMART didn't push us aside. They recognized us, and we are starting slowly to adopt this technology. And we have actually started using it for about 3-4 years. We have about 300 people who have now migrated to use the SMART technology. But in total, we have about 20,000 members. 20,000. These are micro-insurance, community-based insurance members, but at least 200 have been able now to join the system, even when actually nobody thought that they could. And we want to thank that. And in the process, we have learned something, and going back to the question, we have learned that actually this technology can benefit the community-based health insurance schemes, can benefit the low-income people, families, can benefit the rural, small healthcare providers, because those are the ones we are using. Health center tools, small clinics, pharmacies in the rural areas, they are usually disturbed by data, internet connection, they don't have regular electricity, but the technology still has helped them, and we have learned that the schemes are operating much more better because of the deployment of this technology in those settings. Secondly, we have also learned that actually the cost has always been the biggest barrier. But with our experience with SMART, the technology that exists can actually be customized to fit into these kind of communities that are actually struggling with very little premiums and trying also to simplify their access to services. So SMART brought their system, and when we had a discussion, they managed to integrate some of what is now helping these communities to also access, for which we are so grateful. For example, SMART has, before moving on to this virtual system, they have been having a SMART card, and it was one person per card. So when we discussed with them, we discovered that the cost of using that system was higher than the premium that the community members were paying. So literally, it was not possible for us to migrate our members to this system. But we appreciate the fact that they sat down with us and they customized the system and uploaded something we think is really, really important, even going forward, that now on one card, it was possible for specifically our community members to put more than one individual. And they use one single card to access services. One family, one card. And this helped these communities with their little premiums to be able to now migrate to this system. So we have learned that cost is an important barrier, but also we have learned that this technology can be adopted, can be adjusted to fit even in this kind of populations. So I think basically for that, this is what I can say. Thank you.
Thank you very much, Frederick. Thank you very much. The applause says it all. Dr. Gonzaga, you seem to be very comfortable. And I've rarely seen a medical practitioner being comfortable. But before I come to you, Mr. Mwiru, the black man, I'd like to prepare you, because I'll ask you to explain the immediate barriers that are embracing digitization for the healthcare sector and how they can be addressed after Dr. Ndabati. So I'd just like to prepare you. I'd like to get you out of comfort zone as you take that glass of water. Dr. Gonzaga, as a medical practitioner, what is your take on the adoption of digital systems in the management of medical data?
Thank you very much, Mr. Simon, and thank you, the attendees. Just to give a small background, I've been in practice for about 22 years now in clinical practice. And for some of you, you may not understand when we talk about the adoption of digital systems into management of health data, because this is where you started. But for some of us who have gone across the spectrum, we started with worn out papers, and then later we started with 1, 2 computers, everybody crowding around. Now we are at this point. And also for me, I have worked in a range of health units. I worked initially with private, not-for-profit, then I worked with the government. Now I'm working with purely private. And the technology in those units are completely different. So I've had an exposure. And so I would like to just share what this means to me. Now, actually, in our unit where I work, that is Bethany Hospital, when SMART came, at first we were a bit fringed because we had been talking about technologies being brought in by insurance companies, and we thought they were coming to ensure that their money is not lost. But when SMART came, within a week, I realized that SMART was smart, as the name is. Because we had had just to do that before I got down to my real experience, we had different systems. And there was a lot of problem with the integration of these systems, the accounting system, the clinical data system, and we were having headache in integrating. Within a week of their arrival, they were able to put some of these things in order. And we were really proud of that, and we are still proud that SMART is there. But back to my experience as a clinical person, what it means, the digital transition in my work. Now, he said, I look relaxed. I look relaxed because my work is much easier now. My work is much easier now. I have no paper in my room when I'm seeing patients. This is very interesting. Those papers, I remember when we were in medical school, they will be falling on the professor, and as medical students, part of our work was to go and pick these papers. Some of them you could not trace whose papers these are. So everything is now on my computer. I just shift the mouse around, I am able to access the patient record. Even those records which were 5 years behind, 2 years behind, I didn't need to worry about what happened in the lab. I don't need to see if the person who did the test in the lab is still the same, because I can access all that information. So digital systems can really improve the access of the patient records, especially for the clinician. For me, I think I've reached a point where I cannot work without the digital system. So it's really, really a big push for me. But also I can see that it gives me the opportunity to interact with my patients very, very closely, you know. I don't have to worry about flipping the pages all the time, you know. I don't have to worry about where will I get this, where will I get this. I have time to talk with I can concentrate on my patient. Why? Because most of this record, once they are captured, they will always be there. I don't have to ask again the patient the same questions. By the way, the other time when you came, what was the problem? Now have they taken your blood pressure? Everything is transmitted to me. So I have ample time to concentrate on the thinking part of my work. And then I am able to really offer the required quality of service to this patient. But also what we have observed in the unit is that this is a very smart way of cutting costs of health care. In terms of, let me tell you the time the patient spends in the health unit. On average, you will agree if you have been a patient that when you go to a health unit and you want to receive service, you spend about 4 or 5 hours. And you never imagine what is delaying. From the healthcare perspective, I'm telling you, out of the 5 hours, 3 hours is spent in processing your data. They tell you, you wait here. What are they doing? They are processing your data. Especially if you go to health units, sorry to say public health units, where they have not adopted digital technology so much. They are spending a lot of time in moving papers, in moving files, you know. You see, so if we can adopt the digital technology, we will be able to really redeem people's time, you know. I have to spend a short time so that I can go and attend to other businesses. So the list of benefits are really endless. And no wonder, now even as I was here, I'm able to communicate with my patients, you know, because I have my clinic on this phone, you know. I have some patients, I do fertility treatment. I have some patients who are on treatment and they are sending me their results and I answer back. So I have not missed my clinic. So life gets better when it is digital. So there is no point in saying there is an alternative to this. We must move forward and make it better. And I want to encourage everybody to emulate what SMART is doing. You know, there are more opportunities from the data. We can pick up and do more things. Yes. Thank you.
You should have clapped for him, really. Because many of you do not recall or never knew or never saw those times when you had to go to a health facility and you first look for the signage, drugs, window number 5, doctor, window number 2, physiotherapist on Tuesday at this time. Then lab, they tell you certain tests are done on this day, certain tests are done on the other day. The only challenge maybe now we have in case of serious illnesses when they have to refer, like they say your samples have to go to Lancet, probably Dr. So-and-so will only accept results endorsed by a certain clinic, which are rare occasions, But if all this can now be done, as you are sitting here, it underpins the fact, what you've actually said, you have found a supporter in Dr. Gonzaga, and really we have no option but to follow. It really means that someone has sat down and done some work, and is probably yet to improve on the work. Now to you, my brother the black man, Mr. Mwiruri, what are the immediate barriers to fully embracing digitization for the healthcare sector, and how can they be addressed in spite of what we have achieved?
Thank you very much. What I would like to answer in terms of the barriers that we see jointly, and I'll refer to a number of conversations that have been made in this very room. I think one of the key elements is on awareness and trust issues between the different stakeholders, and the lack of awareness generally in the population on digital options of access to health, and how healthcare systems can be, or how healthcare programs can be managed better, ends up being a barrier towards the growth and scale and sustainability of these healthcare programs. The solution to this have been alluded by my very able guest, that is Jonan, who spoke about communication and engagement, breaking down the areas that are not clear. And this has been also been picked up by the regulator, and the comment that he made that there is indeed an action to see how we can inform the patients or members, and that's a representation of the general population, on ways and means that they can access information on their healthcare programs. The second issue that was also alluded to in the conversations that we've had here is a silo mentality, the fact that as healthcare practitioners or stakeholders in different elements along the value chain, we have tended to look at what is innate for my area and space that I am working on now, instead of looking at the greater good in terms of what could arise from better collaboration and better engagement. And I think that also is resolvable fully through such mechanisms as associations. And I want to pride the work that's been done by UIA, the Brokers Association, the Uganda Healthcare Federation, and many such actors that are bringing the industry together to break down these barriers on silo mentality and look at the greater good in terms of how collaboration can solve the barriers to use and scaling up of digital health solutions. Then I want to also talk about costs, and it was alluded to in the testimony that we had from Self for Health. And it's alluded to the testament of what we are actually launching today as Smart Access, which is actually a more accessible and cost-effective solution. It actually reduces the cost of onboarding by up to 35%. And that means that if we look at solutions that are more affordable, then we can bring down that barrier to access by bringing relevant homegrown solutions that use tools such as the mobile phone that are already prevalent in our society. And finally, I want to talk about policy. I think there's worker stakeholders that we need to continue to engage the different institutions, both government and also looking at policy from a self-regulation perspective in order to ensure that there is enabling policy that drives the digital health agenda. Thank you.
Thank you very much, Mr. Mwiruri. I'd like Dr. Gonzaga to take note, especially with the last comment he made about policy, because that's the role of government. I think he has underpinned the achievements that you have talked about and the support in this continuing effort. I think looking at it from your health institution and with your experience, I think you're in a strong position to come up with those areas where this engagement can be furthered, because I hear collaboration, collaboration, collaboration. And I think as part of your work, you also have community initiatives, how to talk to these people, how to get to them, and the other personal issues. So I'd like you to really take note of that and I'll come for a comment from you. But perhaps some of the other issues he has touched, Esther may have a solution because, again, some people fear to visit hospitals because of privacy. Now, do we achieve this through the smart access? And Esther, then, how do we ensure security and data privacy as we utilize the propositions like the smart access?
Thank you. Thank you so much, Solomon. I know as I come to answer the question, the room will agree with me that indeed healthcare data is the most important data for all of us. Of what the kind of data we have, about ourselves, healthcare data is core and we keep it close to our chest. What we have seen, and I know a lot of us will agree with me, is that in this era of a lot of technology advancement, also comes a risk of hacking. Yes, where people would want to hack information either on your phones, on your system. We are very keen and smart to ensure that indeed all the platforms that we provide in the healthcare space are fully compliant with the data protection laws in country. For the Smart Access app, we've been able to implement what we are calling two-factor authentication, where you can be able to put your PIN, that is a one-time PIN, and also a password, just to ensure that indeed you as the member have the sole right and access to your data. We've also put in place what we call a data masking or encrypting, just to ensure that any data, either on transit or data on rest, is completely encrypted. So you cannot, let me use the word, hijack data on transit or e-claims and be able to deduce what it is. We are also very keen, and allow me to say that indeed it is through this importance that we have placed on data that we did allow for the audit in terms of being able to be audited by a global firm to confirm, and we did get certification just the other day in December, a global certification on data security, that is the ISO 27701, where now we are fully accredited in terms of placing on the smart system the highest standard of security within the healthcare data.
Thank you very much, Esther. I really want also to submit that security will remain a problem, and I'd like to urge you to continue doing what you're doing and do it faster. My son, now in S3, didn't have a phone during his P7 vacation. So he learned a smart way of using my phone. He'd run to my bedroom when I'm downstairs. First of all, remove the volume so I don't hear what he's doing. How to beat my password is to claim he has forgotten it, so he puts in his. And then how to beat the airtime. He always gets airtime through the mobile money, and he presses that field of continuous renewal. One time or renew on expiry. He did that, he did his things. We actually exchanged, and I found it wasn't really good enough. I was losing a soul. So I decided to buy him a phone. So I do applaud what you have done, and I want to say, let's not go into comfort zone, because for us in insurance, we know that fraudsters often do move ahead of us. But I can give you another round of applause for really taking the initiative, being conscious of it. I will take two questions from the floor, one from this side, one from this side, though I guess most of the concerns have been addressed. But before we do, I think it's important, Dr. Gonzaga, to put this in perspective, as I told you earlier, by sharing with us, in your opinion, the tangible efforts the government needs to put in place in creating and supporting stronger digital health systems and commitment thereof. And the other reason, really, I may sound attacking you, is because of this famous word, tusaba government yetu yambe. Tomorrow, smart access will be good, and the next thing you hear ladies at Women's Day saying we want government to support us. You know, government yetu yambe. But you have got the practical approach to it. You may give us one or two comments. Then I'll take questions, one from this side, one from this side, and then you prepare your parting shot, my brother Frederick. Dr. Gonzaga.
Thank you very much. as I said earlier, I worked with the government, but my current position is more of an observer. But,
Some volume, please. Yes.
Yes, it's more of an observer. But I have special interest in the digital applications. In the side of government, I think all of us have seen that government has put in a lot of effort, not in introduction of digital system in the government health units as such, but in the general, because we even have a ministry for ICT, and we even have other bigger departments within there. So it's a whole move by government to try and support and promote. So we can really visibly see this. But on the side of security, it's still a worry. And we all have to be smart in observing what we are doing. And any leakages in the work we are doing, or leakages of information, must be handled with caution. And so that we support government, because government, who is government? We are part of government. We are the users of these things. So if you do not volunteer the information, if we support the frauding of the system, we will be the ones to lose again. So we have to cooperate with the government in identifying those gaps, in submitting them, so that they keep on improving the system that supports our work. So government, the work is mainly regulation, but also promotion of our work. Yes. But government cannot promote what you are doing if you do not make it visible. Some people make systems which may be as good as the one of SMART or something like that, but they are never seen, you know. So as Ugandans, we are used to keeping a bit behind. We don't want to market ourselves for reasons which are not clear. If what you are doing is of value, for example, the department of IT in Makere, there are students who are doing a lot of work there. We don't get to know what they actually are doing. So we have to collaborate with the government in trying to support our work. That's what I can say.
Thank you very much, Dr. Gonzaga. And really, your submission speaks to, and again, commendations to Smart Access. In one of the slides Jude presented, they had identified over the years 2021 their prominent diseases. When we talk about respiratory issues, and I think in 2020, number 3 was UTIs, which actually faded over the subsequent years. I think that's very important data, because sometimes it is communal. It involves more than one person. And I think there should be an engagement with these providers, also with the government, to see the initiatives that they put in. In our days, they used to spray swamps with DDT. Now I think it's not done. Everyone on his own, although there are those mosquito nets for each person. I'll take then 2 questions. One from this side. May I request the person with the microphone to move it? Kindly, 2 cautions. Make it brief, and don't repeat what the previous speaker had said. We do that in Parliament, okay? Don't agree with him or disagree. I think give us an independent question. And then the other one from this side. Who's asking from this side? Who is asking from this side? Because I'll take only 2. All the 2 are this side. Okay, let's have the questions. Please also mention to whom you're directing it, okay?
Yes.
Thank you. And your name and where you're from.
Thank you very much. My name is Ngwero Emmanuel, a software engineer from NetDoc, a telemedicine innovation. My question goes to SMART. Thank you very much for the innovation. My question is there an endpoint that us, as software engineers, can connect to access the insurance policies or the virtual card at the moment? Thank you.
Is the question clear, Esther?
Yes, it is.
Okay, you'll come to it. Thank you. The second question?
Thank you very much. My name is Ivan Onyuta, and I work with Uganda Healthcare Federation, which is the umbrella body for the private health sector. Mine will still go to SMART, and I applaud SMART for this innovation. It's very clear that the private sector has challenges, especially with transmitting health information or health data into the national systems. which is the DHIS2 that aggregates data for the country. And therefore, that gives challenges to the government in terms of planning as well as quantification and also policy and determining the processes that are needed to manage disease and even pandemics. So with the innovation that we do have that has been launched this morning, it would be of interest to me and other stakeholders to know how the information from the private health facilities, and especially those that are already using SMART, how this information can actually be translated into the national system.
Thank you very much. We will get Esther to answer those two questions. And then I think after those also, Esther, you give us your parting shots. Then we'll come to Dr. Gonzaga and my brother, Frederick Makaire. And we'll continue with the program. Thank you very much. Over to you, Esther. You got both questions? Thank you very much. Yes, feel free to call on Mr. Mwiru if you want to supplement.
Thank you. I'll just take the first question, which was in terms of how are we allowing, have we made available endpoints to be able to allow either developers or other ICT firms to be able to integrate. We are working on that. It's part of our roadmap. And what we are doing is to be able to provide open APIs to be able to have integration to some level, and we'll be discussing with different stakeholders because we're also very keen on being able to allow for telehealth as we come to phase 2, which will enable the app and every member to be able to call up a doctor from their phone and go through the entire ecosystem of healthcare, from consulting a doctor to getting medication all the way to the whole 360 cycle. So we will be sharing that in due time, but indeed that is part of our roadmap on providing open APIs for the first question. In terms of the second question in regards to how smart and how we can be able to work with government, yes, we are definitely a very big campaigner and advocacy in terms of how can we be able to share this information. One of the key things we're looking at is to be able to partner with the likes of UIA as well as other stakeholders and be able to have like a subset committee how we can be able to provide this data with insurance companies, with the providers, and form a full committee of stakeholders to be able to move this conversation forward all the way to how government can be able to benefit from this information.
Right, thank you very much. Mr. Makaire, your parting shot briefly.
Thank you so much, and thank you, congratulations to SMART for reaching this milestone. I also want to end by thanking and also encouraging all players not to fear the informal sector, but to reach out to us. Currently, we cannot afford, probably in this room, we can consider ourselves as outliers. Probably when you look at people in here, the industry is different from ours, but we appreciate SMART for bringing us to this table, even when probably we feel we don't deserve to be here when you look at the kind of target groups we are considering. But we thank you for bringing us to this table to discuss these issues. We also thank the Uganda Insurers Association for the support, because they are like SMART. Even when we don't deserve to be in the big insurance industry, they support us. When we have an activity, Jonah, thank you so much, because we get financial support, and when they have some activities, they invite us, even when we are from community-based health insurance. So we appreciate this, and we very, very much bring you the issues from our members. As I close, first of all, they feel so proud when they have this technology. Those 200 members who are using the smart card, their satisfaction levels went up with the schemes compared to the others who are still using the analog system. So they are very proud of being on the technology on this system. They are very much concerned about the offline times, and we request SMART and other technology providers to improve that area. Because our service providers are rural-based, our members are in the villages, sometimes when they go to the facilities and there's no network, there is no electricity, they face challenges. So we are requesting that the offline services, if they could be improved, and if the transactions can be sometimes completed or even when it's offline, I think our members will be much, much, much happy. And finally, if this technology as one of our, we think our members will be taking advantage of this virtual access. We hope that many of the community members will now enroll. We just request SMART, if it's possible, to consider putting some additional languages, local, into this platform. So that if our village community members want to press star something and then they follow the prompt, if it can bring in some local languages, then we think they will easily use the system because that's where sometimes they have a problem. They want to use it, but then it is not user-friendly, mainly because of the barrier in terms of language. Otherwise, we congratulate you once again. We want to thank you. And coming from the rural areas, usually if you listen to radio, when our people call in a radio station, they don't end before sending greetings to their colleagues. I want to just to introduce my community members. Christine Makovole there, please. This one is from the Uganda Protestant Medical Bureau. They also promote community health insurance schemes. Then Kabale Robert, this one is from Muno Muburwadde in the Luwero area. Nansubuga Dorothy, this one also is from the community health insurance schemes. Thank you so much, and God bless you.
Thank you very much, Fred, and God bless you too. And we shouldn't forget this point. Jonan and Mr. Mwiru, he has struck a very important point that is my passion. Domesticating our products in the language. I feel very embarrassed when I hear my colleagues in Kenya and Tanzania refer to insurance as Bima. And here we are calling it Yinsua. I don't believe with Yinsua. I think Yinsua is Ugandanizing English. I think we should find a name. So your point really about access and getting to the people who matter is valid. Congratulations upon the access bit of it. Kindly extend your access also to the language. Please work together. The word here is collaboration. You have the supporters, you have the numbers, you have the tests. Dr. Gonzaga.
Yes, thank you very much. Yes, I want to congratulate again SMART, and thank you for being smart in this field, and you are doing the right thing. And for digital is the way to go in terms of offering quality health services. It empowers and promotes every player, the patients, the providers, and even the policymakers. And so we must all arm up our hands and embrace the digital migration. Thank you.
Thank you very much, Dr. Gonzaga. A round of applause for you. Finally, Esther. And I ask the panel, the congregation, please, you remain seated. There are still some closing items. Once we finish the panel, there are still some other activities. Please don't go away. Esther, please.
Thank you so much. Thank you so much, Solomon. I think the mic has, okay, it's back on. Thank you so much. Indeed, for me, is to appreciate and say thank you for your time this morning. We are very committed and geared in terms of the different phases. What you have seen today is just the beginning, what you're calling phase 1. The plan is to be able to have up to 3 phases of the app that will incorporate every market, every need, every insurance company in this room, brokerage, hospital, stakeholder within the 3 phases. And we will be coming to all of you because we're doing this together as a whole, as a family, and to be able to move the industry forward from the 1% to at least get to 20% within a particular period of time. That is our target, and thank you so much.
A round of applause for my panelists. And just in closing remarks, ladies and gentlemen, I believe the launch has been successful. Ladies and gentlemen, Yes, Pamela, you can go ahead. The launch has been successful. Your discussion brings it out very well. Jonan, I know you're looking at the screen because you've been wondering. I was panicking whether I'm going to stand this long, mainly because of the message on that. That is a diagnosis in December 22nd, and diagnosis was a cerebellar stroke. I'm just recovering from a cerebellar stroke, and this is my first public appearance. I'm sharing that with you to get the joys and encouragement as you have given me that I could stand this long. But also the message I got from the professor, he told me, if you love your life, look after it. I think the message about our lives and looking after them, I should share it with you. This is my first public function. The doctors at Aga Khan told me that what you are, what you feel is what you are. If you feel you're sick, you're sick. If you feel you're well, but make sure you are in control, you have the information. Smart, I thank you very much for this information. From here, I'm rushing back to bed because that is my program. But I was also raised to do it, and it has come timely. John, and you don't have to come and woke me up like last Friday. I think I will walk down. We have had a very wonderful discussion. Congratulations, Smart. Thank you, everybody. Let's go ahead and be each one's brother's keeper. As the Bible tells us, care for one another, collaborate and share the information, and see a better tomorrow, ladies and gentlemen. I'd like to thank you very much again and invite the Master of Ceremonies to continue with the rest of the program. Should I dismiss my panel, Master of Ceremonies?
Not yet.
Thank you very much, ladies and gentlemen.
Friends, can we give Solomon on the panel a big round of applause? Solomon, we thank the Lord for your life, and as you continue to enjoy your recovery, we have a package for you that as you'll be sleeping and you wake up, you'll have something to eat. We have wine for you, but we also have a package for the rest of the panel. Doctor, I'm not sure that you'll be very comfortable with the wine, depending on your lot of science, but whichever way you look at it, you'll share with your family. And at this point, can I invite Harrison and Judy to please appreciate our panel together with the moderator and pass over these gifts. For these ones, we did not participate in a raffle draw. We are sorry, but these ones for raffle are still coming. Please come. Stand right there. Stand right there. Please move to the front where the photographer can see you properly. Right there. Jonan, please come. People, it's in order to clap. It is in order.
For yours.
Can I then go?
Yes.
Thank you very much. I break 30 minutes.
Thank you very much, sir. Okay. So because you are the hosts, can I also invite now Jonan to also come and receive his? People, as you noted, Jonan represents key partners, so can we clap for Jonan? Because the volume of the clapping will represent the nature of business he'll continue to bring to Smart Solutions. I didn't know there were more packages. This is for the MC? Okay, it's okay. Thank you very much. So at this point, I need to invite Rukia Bari, who is the Customer Relations Manager, to come and appreciate, starting from the group, then to the country. Harrison to the front. Extend to the front. I'm now worried. Then you put that down, then you come and now award. It's difficult to work for your bosses because it is a thin line. You almost want to award them and carry for them. So... So thank you very much. Thank you very much, Harrison and Judy. You can take your seats. Ladies and gentlemen, we are coming to the final stages of this conversation. I want to think that all of us signed the placard for the virtual card. I request the Smart Applications team to make sure that Jonan's signature is appended on the placard, as well as Solomon before they leave. Let us make sure that a number of us get the signatures on the placard. At this point in time, we're going to cut cake to commemorate this ceremony, and on that very, I'll still call our keynote address Jonan, together with the team, to come and we cut cake, and I'll request the Smart team to then start on the distribution process. I request the team, and the tech team, to give me some videos as we run. It can be sound, it can be our players' videos, to join us on this. So thank you very much. On the count of 5, on the count of 10. All right, on the count of 10, when I reach 0, all of us will clap and make some noise, and the fireworks people will pop. Jonan, let's raise the knife. On the count of 10, 8, 6, 4, 2, 1, and 0. Those things will pop because you bought them. Make sure they pop, by the way. Pamela, make sure they pop. Finally, that's enough. Finally, that's enough. Yeah, Harrison, you can go back home like that. It will represent that you indeed attended the launch. So I request now the Smart team to handle the process of the distribution, and given that we are few people, Sharon, because we are few people, cut big pieces so that people enjoy the cake. Friends, like I said, we still have gifts to give away, and we have Mari Stops with us. I do not know if a representative of Mari Stops is with us. Are they still here, Mari Stops? Where? Okay, once Mari Stops is here, please let me know, and then I can continue with the distribution of the different gifts. At this point in time, friends, as we finalize with the program, allow me call Peace Owor, who is a business development and brand manager at Smart Applications Limited, to come and move the vote of thanks. And after that, I'll pick some feedback. For those of you that have managed to interact with the application, I'll pick some feedback, 1 or 2, 3 hands in terms of where you think we need to improve. But Harrison, we already have some talking points in terms of the gentleman that raised the API conversation of ensuring that the application can be able to interact with others. So we already have some takeaway points. Do I have Peace with us?
Is Peace here? Yes, Peace, please come and move the vote of thanks.
Thank you, Gava, the MC. Hasn't he done a wonderful job? Let's give him a round of applause. Yeah. Ladies and gentlemen, our distinguished guests, on behalf of Smart Applications International Uganda Limited and the entire Smart Applications Group, we would like to sincerely extend our gratitude for your participation in this event today. We do not take it for granted that you've spared your time to come and spend time with us this morning as we launch this innovation, our great innovation, that's Smart Access, which we are calling the next big thing in the insurance industry. Let me call it the healthcare industry. So we do not take it for granted. Allow me thank our guests, our partners, and our clients. Those are the insurance companies for sparing your time to be with us this morning. And would also like to thank you for your partnership and your cooperation that has given us the motivation to move forward in coming up with this innovation that is changing trends within the healthcare industry. Moving on, I do not want to forget our panelists, our keynote speaker. Thank you so much for giving us those insights when it comes to the industry performance. And I believe that today, this has been an eye-opener for most of us in terms of knowing what is happening within the healthcare space. We are indeed very grateful. Our panelists were extremely grateful for the knowledge that you've shared with us this morning. Thank you, Frederick Makaire. Thank you, Esther Miruri. Thank you so much, Solomon Rubondo, for moderating that session. I would like to appreciate Dr. Andabat Ngonzaka. Thank you so much for your participation as well and for sharing with us those insights in terms of how technology is transforming the healthcare industry this morning. We are indeed grateful. Moving on, I would like to extend a special thanks to the team that has put this in place. Thank you, Smart Applications team, that has tirelessly given of their time and of their expertise so that we can come up with a successful event. And as well, I would like to thank our partners that have sponsored this event in terms of giving us the different packages. I would like to thank our suppliers and our event manager, Kadanke Media. Thank you so much for coordinating this event so well, and we've had a really, really successful event. I thank you so much for the entire team for putting your best foot forward for us to have a successful event. And I would also like to extend a special thanks to the media. Thank you so much for showing up this morning and for making sure that our event is aired out there on the different media houses. And we would like to really, we are looking forward to seeing the feeds on the different platforms. And yeah, we are looking forward to seeing Smart being aired out and looking at the information in terms of how this big thing called the Smart Access is making big impact in the entire healthcare industry. I believe this morning we've learned a lot, starting from our first speaker, Harrison Miruri, the Group Managing Director for Smart Applications. And then Judy also came in with great insights in terms of updating us on the industry trends. We really, really thank you so much. For the entire session, I believe we've all had a great moment this morning. Thank you so much, all of you, for sparing your time and to be with us. Definitely, if we are not here, we wouldn't have had an event. But the fact that you showed up and you spared all these hours to be with us this morning, we do not take it for granted. Thank you so much, and may God richly bless you. I think at this point, I hand over to the MC, Ibra.
For over 30 years, Mary Stops Uganda has consistently delivered high-quality sexual and reproductive health services to Ugandans. We deliver health services through various channels, including our 15 clinics, which offer general health care, sexual and reproductive health, antenatal care, and family planning. We are evolving to serve you better through our new highly specialized hospital and maternity located at Lugogo Forest Mall. The hospital adds to our nationwide portfolio of 15 clinics and exemplifies our evolution to walk with a woman, her health journey, from the menarche through childbirth to menopause. Our range of client-centered services include maternity services, antenatal, delivery, and postnatal care. To support safe delivery, the Mary Stops Hospital and Maternity offers maternity obstetric services, including antenatal care, exceptional delivery care, and postnatal care. We also provide newborn and infant care, including vaccinations, gynecological services, including...
All right, thank you very much. Can everyone exchange a right hand of friendship to their neighbor and tell them thank you for coming and thank you for making it to the lounge? Exchange a right hand of friendship to your neighbor. Give them a high five, give them a high five, give them a high five. Give your neighbor a high five and tell them thank you very much for making it. As we close, friends, we'll be closing with the anthems. But before we get to the anthems, I wanted to pick some feedback. For those of you that have managed to interact with the app, can you share some feedback? I can pick 1 or 2 hands. Feedback, thank you very much. Can I request the smart team to come and help me move this microphone? The smart team, can you send me someone here to help me move this microphone immediately? Hajat, please come here, the closest. I see a hand over there. Please move.
Okay, like from my view of the clients I normally receive, some clients are not aware of this smart virtual access, smart access. So I don't know. It's always us, the medical workers at the facility, to teach them. So do you have anything for them, like to teach them from their place, or we have to teach them?
Yeah, that is feedback. Harrison, I am not going to do your work. Do you have either Harrison or Judy or Esther? You will answer. Good.
Thank you for that question. Good afternoon, everyone. Regarding client sensitization, this is an ongoing process. What we are currently doing is we are engaging the respective insurers, that is the insurers to the clients, as well as different brokers. And we're also preparing more of these kinds of sessions where you can actually get all these members sensitized and know how to access through the virtual access.
Thank you very much for that question. Any feedback? More feedback? Ladies and gentlemen, do we have any feedback for those of that? Yes, over there, we have a hand. Please move there. People, I don't know if you remember those sessions in class where the students that were participating more would be gifted. Please share with us these insights so that really Smart can be able to pick.
Thank you very much.
Yes.
My name is Margaret Adon from Fawe, Uganda. I interface with the application a lot. And my observation is when one of probably a person is activated onto the application, the movement of the data into the person's account takes quite a long time. So ideally in the smart system on the other side, it is activated. However, if the person has the application on this side, the information is not there. So they are unable to actually access the medical services. Thank you.
Okay, thank you very much for that feedback. People, when you see me not responding so much on technical matters, technology and healthcare, I did arts. So just allow me pick feedback, and I'm sure the respective individuals will see how to harness it.
Yes, thank you very much. I've noticed that the application has biometrics.
Has
Yes?
biometrics?
Yes.
Mm.
But my question is, in the physical card, one needed to input a fingerprint. So my question is, via the virtual card, have we moved away from the fingerprint? Because some phones as well, I think latest iPhones don't have fingerprints. They only have face recognition and pins. So my question is, have we moved away from the fingerprints at the moment?
Okay, smart team, you'll answer that. I don't know about the new iPhone, but I know that the latest Techno still has fingerprint. I'm not sure about iPhone. People, I think let everyone comment in the field they are comfortable with. More questions and feedback session in terms of how you've interacted, because this is an ongoing process like Esther mentioned, and we're trying to see that we build a product. But just in terms of what the lady from there, the hospital mentioned, I think it's important for us as Smart to also get some leaflets that you can put at the hospitals to scan here, because at least I pick a lot of information when I go to the hospital to be able to interact with my insurer with ease. Do you have any feedback, any more feedback questions? One final one. You can also just tell us, I think the application is very good. That is also acceptable. And at least you've provided comfort to the developers. Can I have the 3 people that raised their hands to share with us feedback rise? The 3 people. The 3 people. Yeah, okay. Can we clap for these people? Because what you have just done I still have gifts. But now these gifts, where is my second microphone? There's a microphone that has been moving around. That's also part of, before I invite Mary Stop, someone just told me to mention the name Rita. And since you're the only Rita that stood up, you have a gift. Thank you very much, Rita, from UHF. Friends, I have more gifts. By show of hands, who wants to win? Now people are seeing hampers. When people see now bigger gifts, the way they put up their hands, please rise, 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 please rise. I don't know if the gifts are enough, but because of seniority, for you come. Because elders, it's not good for elders to miss. How can an elder miss? The representative from AAR, where are you? AAR, please come and give away what belongs to you. I have many people. I have many people. Please pass over. On all of you who are standing up, who can live for the other, for heaven? Your reward will be in heaven. I don't know if any one of you is willing, but no, thank you very much. Now, I think 1, 2, 3, 4. I only have 5. So choose 5 of yourselves and come. 5. When you see that 5 are ready, the way you have come in a line. Where's the customer relations? Where's the Rita? Please come and give these gifts. AAR, you have overworked. Let us give out some of your packages. Let me call the dental people. As they come, they will tell these people what is in there. Please award one by one. Who of you wants dental? For you, wait for. You want dental? A general checkup. Okay. Okay. So this is the final AAR, general body checkup. For everyone that has received and the one that has not received, thank your neighbor and tell them next time is better. Next time will be better. Ladies and gentlemen, we have come to the end of the launch, and I think we've done ourselves well. Can we give ourselves a big, big round of applause? Certainly, this would not have been possible without Smart Applications International. They've done us well in terms of sponsoring this breakfast luncheon, which has almost spent some time. We also have partners that have joined us. Millennium Dental, Millennium Optics, we have C-Care, we have Mary Stops. But at this point in time, can we put our hands together for the SMART team? The people that have been a back end trying to put things together. Can I request Sharon, Pamela, and team to come to the front and we take a picture? I'll request Esther together with Harrison to come and also join the team. We take a big picture that we'll put in our boardroom to forever remember when we're launching the Smart Access. Can I request the entire SMART team to come to the front? But before you come, sorry, I've been reminded, before you come, Hazel from Mary Stops, are you here? Hazel from Mary Stops, are you here? Hazel from Mary Stops, please come. These people of Smart really put so many gifts. Some gifts are even forgotten. Can we clap for Hazel? Hazel has also carried more gifts. Please bring the gifts. Hazel, you want to speak to us for a minute, or we use your video? They use the video. Please give us the video for just a minute and we agree on the criteria of distribution. The Mary Stops video.
For over 30 years, Mary Stops Uganda has consistently delivered high-quality sexual and reproductive health services to Ugandans. We deliver health services through various channels, including our 15 clinics, which offer general health care, sexual and reproductive health, antenatal care, and family planning. We are evolving to serve you better through our new highly specialized hospital and maternity located at Lugogo Forest Mall. The hospital adds to our nationwide portfolio of 15 clinics and exemplifies our evolution to walk with a woman, her health journey. From the Mary Stopes Hospital and Maternity offers maternity obstetric services, including antenatal care, exceptional delivery care, and postnatal care. We also provide newborn and infant care, including vaccinations, gynecological services, including treatment of fibroids, infertility evaluation and management, cervical cancer screening, and treatment of precancerous lesions. Services including family planning, post-abortion care, and management of STIs. General outpatient care, including COVID testing, comprehensive laboratory services, diagnostic scans, including 3D. We are open 24/7 and have a standby state-of-the-art ambulance to respond to emergencies. Our contact center team is on hand to receive your calls toll-free, provide information, book your appointments, and follow you out. For more...
Thank you very much. That is Mary Stopes and this is Hazel. There's a lady that put up her hand over here. I do not know if she's still here. You had also wanted to win. Jesus has remembered you. Please come. Can I also tell Rita's neighbor? Rita, choose on your neighbors there. No, but give me this lady, please come. She was also very instrumental at the beginning of this. Please come. Please receive from Hazel. I have 2 more gifts. But the Baganda say, omugabita kolachi. Omugabita yesera. I don't know if... Thank you very much. Hazel, do you also award MCs? Do you also award MCs like I can receive? Yes. Okay. You give me that one. Who they've pointed at, please come. Some people want to win, but then they don't want to stand. Hey, I see why you wanted her to win. Yeah, pass here slowly. Mary Stopes take care of you. So we are giving you the gift as you go home. You share with your husband. Friends, it would be very mean of myself not to award myself. I see some of you are not happy. But everyone eats in their office. But at this point in time, allow me also, send our shouts out to our virtual team. Our virtual team, you've been incredible, all the way from Zoom, YouTube. You've done us well. I want to invite the SMART team. Can we give a big round of applause to the SMART team for putting this together? Can I request everyone from SMART, Pamela, Sharon, together with the team, please come, Judy, together with the team. Can we come to the front and we take a big picture, a big group picture that we'll put in our boardrooms and forever remember that we launched a facility that supports individuals out there understand how to access their hospitals, where and how, their utilization in terms of insurance. I think it's a very good system that we've launched today. Can I request that we also come with our virtual card, our placard? Gentlemen, please pick for me our virtual card placard so that our first picture is this, and then after we'll have that as well. The SMART team, please move to the front very fast.
Ladies and gentlemen, thank you so much for your time. And this event wouldn't have been the same without you. But above all, I want to recognize our MC. Hasn't he done a wonderful job? Let's give him a round of applause. Ibra, we have a gift for you. You could not have given out all those gifts and then you go empty-handed. So Harrison will help me to give this gift to our MC today. Thank you very much. To the SMART team that is still out there, please come.
Can I request the Kadanke team to come and help me remove the podium? Here we have gentlemen, SMART team. Please come and work for your appraiser. Want to put it down here? Don't worry about, just display the front of the phone and show the application. I'm sure some of you now are busy thinking about, where's our virtual placard? We'll also need to have a picture with it. Only show a screen that has the application. Thank you, thank you. So it is always important to smile in a company picture. You'll be remembered for. Can I request that we get the placard also in front? No, the placard. Okay. We can tilt it a bit down. We can tilt it a bit down. Exactly. So I'm going to request everyone below the age of 30 in SMART team to give me some excitement. Give me some excitement below the age of 30. Yeah, give me some excitement, because we can't post a picture that is not as cool. Give me a picture. That's it. Thank you very much. Don't leave. Can I request everyone to rise up? We have the anthems and close the event, so that departure is at leisure. But thank you very much from us, the SMART team. Would like to thank you very much for dedicating your first half of the morning with us. May the Lord bless you richly as you continue with the rest of the day. The Kadanke team, the anthems.
Oh, Uganda, may God uphold thee. We lay our future in thy hand. United, free, for liberty, together we'll always stand.
Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Thank you very much, ladies and gentlemen. May you enjoy the rest of the day. God bless you.